Newton Benka is a professor of epidemiology at the School of Public Health, University of Ghana. Thank you so much for joining us this afternoon. And Professor Alex Dodu, who is a clinical pharmacologist, director of the World Health Organization Collaborating Center for Advocacy and Training at the University of Ghana, and the Director General of the Ghana Standards Authority. Let me also say that Professor Fred Newton Benka is with the University of Health and Allied Sciences. Gentlemen, great to have you and good afternoon to you.
Good afternoon.
I'm going to go for this quick break. When I come back, we'll get into the conversation and acknowledge our sponsors who are going to help us through this all-important conversation as where we are as a country with respect to the fight against the coronavirus. I am Alfred Okanse. Welcome.
The world is in very dangerous times. COVID-19 is here. The World Health Organization has declared it a global pandemic. And so Media General wants to entreat you and yours to stay safe, to stay healthy, and to observe hygienic processes.
Ghana has recorded some cases of coronavirus, and it is advised that you don't touch your face, your ears, your nose, and your mouth with unwashed hands. Wash your hands with soap and running water.
Cover your cough or sneeze with a tissue. When you're done, dump the tissue in a bin.
These are not normal times, and I'm quoting the words of the President of the Republic of Ghana, admonishing all of us to stay safe as we record cases of coronavirus in the country. We here at Media General are encouraging you to stay home when you feel sick.
Every life matters, and that's why we cannot afford to lose a single one of you. It's very simple. Just adhere to the directives given by the WHO and the Ghana Health Service. Let's stay protected, let's stay healthy, and let's drive out coronavirus. See you on the happy side.
How we will get there, but we know we will.
Oh, my motherland Ghana, being swallowed by garbage. Now over the den. Who is responsible?
It's the responsibility of every Ghanaian to police the environment, to make sure that we do not litter around. We should not pour garbage into drains and gutters. We shouldn't do open defecation. There should be each house one toilet and each house one dustbin.
There is a public toilet. You say you don't use it. You prefer going to the beach. How?
Kazu bola cikin gota zai shiga cikin gidan wani ya bata mai shi kaya aramu ne bai yi ba shi yasa kuma mu duka mu yi sabta kanmu mu yi sabta
sai ya passenger sai ya driver ni o men didn't find do and find to farm
an ka be sire obia se obia nfa no hunji sanitation campaign mu said e be ya bibia be fine.
So we are all responsible for the garbage. Rise up, Ghana! Join the sanitation campaign to keep garbage out of Ghana. Hashtag garbage out.
This campaign is powered by Media General. Hashtag garbage out.
The world is in very dangerous times. COVID-19 is here. The World Health Organization has declared it a global pandemic. And so Media General wants to entreat you and yours to stay safe, to stay healthy, and to observe hygienic processes.
Ghana has recorded some cases of coronavirus, and it is advised that you don't touch your face, your ears, your nose, and your mouth with unwashed hands. Wash your hands with soap under running water.
Cover your cough or sneeze with a tissue. When you're done, dump the tissue in a bin.
These are not normal times, and I'm quoting the words of the President of the Republic of Ghana, admonishing all of us to stay safe as we record cases of coronavirus in the country. We here at Media General are encouraging you to stay home when you feel sick.
Every life matters, and that's why we cannot afford to lose a single one of you. It's very simple. Just adhere to the directives given by the WHO and the Ghana Health Service. Let's stay protected, let's stay healthy, and let's drive out coronavirus. See you on the happy side.
How we will get there, but we know we will.
Welcome back from that quick break here on TV3. We're live on TV3 Ghana on Facebook, DSTV channel 279, all across the world, and 3news.com. And this is the expert panel discussing on the surveillance, containment, and treatment of COVID-19 in Ghana. As you may already be aware, recorded 24 cases, 23 active, 1 dead. And this is where we are. The president addressed the nation the third time, giving his what's we've been doing so far as a country. And I've been joined in studio by Dr. Ishmael Norman, once again the President, Institute for Security, Disaster and Emergency Studies, to my extreme right, and then also Dr. Victor Bampo, who is a former Deputy Minister of Health and Coordinator of Global Financing and Technical Support of UNAIDS. Also with us in here to help us with the conversation, Professor Alex Dodu, who is a clinical pharmacologist, director for the WHO Collaborating Center for Advocacy and Training at the University of Ghana, Legon. And for us, many of us do know him as the Director General of the Ghana Standards Authority, but he's doing lots in many ways. And also join us in studio is Professor Fred Newton Binka, who is a professor of epidemiology at the School of Public Health, University of Health and Allied Sciences. UHAS in whole. Gentlemen, once again, I want to thank you and also acknowledge our sponsors helping us throughout this conversation. Carex, so if you see lots of the hand sanitizers, it's right here, and we're encouraging you to ensure that we adhere to the safety measures. Your discipline will save my life. That's really very, very important. We're going to start off with 5 minutes submission from all of you, assessing where we are now, listening to the president over the weekend and the measures that have been put in place. Let me start off with you, Dr. Nima.
Thank you very much for this opportunity. I think right now the whole national response to COVID-19 appears to be very chaotic. And there's a great deal of fear in the public because they don't know what actually is happening. I drove from Malam all the way to here through Waja, and most of the shops along the way are closed. So people are basically going into voluntary lockdown. And I think in terms of the number of cases, it is not so alarming in terms of the confirmed cases. What is alarming is the fact that we are not testing, and so we don't really know the actual number of cases from local transmission, and so community transmission. And I think this is what is making the community very, very fearful. I actually don't understand why we are not in a lockdown situation at this moment.
You think we should be on a lockdown?
I think we should be, at least in a limited way, in Kumasi and Accra, so that we don't spread the disease to other parts of the country where we haven't had any confirmed cases. Because the longer we wait for a lockdown to occur, the greater the risk to the population at large. So for me, I think government is confused about the approach to the disease, COVID-19, and out of the confusion, even from the point of view of the law and administratively, the legal confusion is with, right now we are in a restricted imposition of restriction. I don't know what that means in the lives of the average person in relation to COVID-19, and administratively, we're not doing a very, very good job. So hopefully we'll get more into details on these issues, but broadly speaking, there's too much confusion on the part of the government, and people on the street think the government is covering up. Too much secrecy. WHO admonishes governments to be open and transparent about COVID-19. If we keep secrets over a disease of really serious significance to everybody, then I think the transmission rate is going to be exponential when we start testing in a serious way.
What informs that position that you think, and you're not the only one who's espoused this view, that government appears to be secretive and is not giving out information as needed? Information is being managed, which you know, some have expressed that it's actually not the way to go. Why do you think that this is really the case?
With all due respect to the presidency, the president has access to superior information than any one of us on this panel. Meanwhile, he came to tell the public that there were 19 cases in his first State of the Nation address. But the whole public in Ghana, everybody knew that there were 21, 22 cases.
So that was the third.
That was just the third one.
The third
right.
one. That was on
So
on
I don't
Saturday.
understand why the president would not have access to that information with his inbuilt access to superior information than everybody else.
So there's a likelihood that because it was a recorded broadcast, that update, I think, came in the later part of the day. You know, so that's why maybe the numbers were not updated as at the time he was speaking. I mean, I'm just hazarding a guess. It could be.
I wouldn't know when it was recorded, so that we cannot really do a forensic analysis of whether he knew or didn't know. But the public, what the public saw is that the president appears to have not been clued in as to the number of cases that were coming. So I think that this is part of the secrecy I'm talking about, because if they were open and transparent, they could have corrected this.
Well, maybe the solution to that probably would be your recommendation for live updates.
Sure.
Not recorded, as
Sure.
we've seen over the period. Dr. Bampo, let me come to you on this.
Okay. Thank you very much for the opportunity. I think we are at a crossroads. Every so often, there are challenges and the existential challenges that countries face. So if you look at the case of Ghana, for example, in 1970, cholera was a big deal in Ghana. At that time, a Ghanaian fisherman who lived somewhere else on the West African coast died from cholera and was secretly transported by canoe to Ghana. It caused a lot of consternation. Fast forward to 2002, where SARS went around the world. You can talk about 2014 when there was Ebola. In every case, it presents the government and the people with an opportunity to make a difference, to learn from history. And the difference between countries who have done well and those that haven't done well is how we learn from the past. So if you look at coronavirus now, I can group countries into three groups. The first group is China, South Korea, Taiwan, which is just 100 miles away from China but has had very few cases, Hong Kong. They learned from SARS, and so they've responded very adequately. Then there are the countries that are not doing very well because they were slow off the blocks, like Italy and the other countries in Western Europe. Then there are the countries who are yet to decide which way to go. So Ghana, I would put in the third category.
You think we haven't decided which way to go yet?
I think that we need to be very clear about what we want to do and how we want to do it. For example, I want to see a very clear plan based on three public health principles. The first principle is about public education. I think when my colleague spoke, he talked about the gaps in knowledge. Whenever there are gaps in knowledge and there's no oxygen of transparency on these gaps, then there are challenges because there's a lot of breeding of misinformation and speculation. So that's number one. Number two is the point of entry screening and also community surveillance amongst the community itself. And number three is preparing for case management. So we need to be able to understand what we are doing in all of this. The final thing I'll say is that it doesn't seem as if we have learned as a country from some of the past challenges. I was privileged to serve my country during the Ebola crisis with some of the colleagues here.
Exactly, and I was actually going to get into that. So what are the immediate derivatives that we can refer to?
Well, I think when Ebola came, we made the commitment, for example, to put in place isolation centers. We had talked about putting one in the middle belt, putting one in the northern belt, strengthening. We did strengthen some of the isolation centers and so on. But had we stuck to that plan to continuously upgrade our facilities, we wouldn't be in the position we are in now. Health systems are not built overnight. It takes training. I mean, one of the things that everybody is talking about right now is ventilators, saying that, it's an upper respiratory tract infection. Yeah. It causes respiratory distress. But when you do buy a ventilator actually has to come with somebody who's trained to use it. So, for example, when somebody is put on a ventilator, you need 3 nurses times 24 hours, 8-hour shifts of people who have been trained to use these ventilators. I have a saying that excites me so much. It says repetition is excellence. What it means is that when people have been using these ventilators for a long time, they get to know how to do it. So there's a difference between bringing in a ventilator and handing it over to a nurse who has no clue how to use them and getting somebody who actually knows how to use these facilities. And these things are built over time. Health systems are built over time. So my final admonishment is that when this is over, let us not go to sleep. Let us actually continue to build it. Because today it's corona, yesterday it was cholera, the other day it was SARS. Something else will come, whether we like it or not.
Great point that you make in there. So it means that fact that we continuous upgrade of our facilities lost out on us has resulted in where we are as we speak. Professor Dodu, standardization, and then again, because if we are talking about ventilators, because that's something that I've heard lots of recommendations. Okay, so if we get to the point where it becomes very critical, people have to get hooked onto ventilators. First, do we even have enough? And secondly, do we have people who can man them? And that falls definitely within your mandate. I mean, to the extent that if we have the professionals, the healthcare professionals who can actually dispense such services with the requisite knowledge.
Okay, Alfred, I'm going to start my submission first by actually having a slightly different view from my brother about the leadership shown by the presidency. I think the president has admonished or addressed the country 3 times on this issue, which is quite rare. It's quite new. It's never used to be. But I will start by quoting the statements I made in June 2015 on the Ebola crisis. I did state that if you only buy a fire extinguisher when there's a fire in your house, it's too late.
True.
And that is to support what Honorable Former Minister for Health has said, that as a country, did we build infrastructure? So let's go back. During the Ebola crisis, I had a chance in 2014 to address the Select Committee on Health. And I made certain submissions that we need clarity, we need messages to come from the highest possible sources, we need to educate the country and move forward. Fortunately, this time round, by and large, there has been communication, there has been a single authoritative voice. Indeed, during the Ebola crisis, I submitted to Parliament that what is the guidance to hotels, to schools? Should people keep schools? Is it to the private sector or to the public sector?
Right.
By and large, there has been clarity on this, though I would also admit that there is room for more, and those rooms for more should be closed. So we are looking at gaps. But where are we now? I'm pleased, and we were discussing before we came on air, that His Excellency the President has chosen a czar, a chief. I mean, someone who will kick the behind of everyone.
Exactly.
And that is Anefi Asamoah, who all of us have worked with and still continue to work with. Indeed, the GSA has him as our standards ambassador. Ever since he retired and came to Ghana, we poached him because we like to prepare. Now, what we have said is that even though he has been appointed by the president to lead, he's a general. And our prayer is that when you send a general to battle, you leave him to lead the war.
And actually resource him to fight
and
the
resource
war.
him. So those two things. But I would add the view that Ghanaians should get involved. For starters, I've been privileged to have been in 2 meetings where the president called the pharmaceutical industry on Monday past, and then on Wednesday, oil industry. And there were 2 things. As Ghana takes its actions, there's a big part we should be aware of. Consequence analysis. What are the consequences of every single action we take? If Ghana decides to go on a lockdown for Accra and Kumasi, we need to ask. For instance, now that we have locked down the airports, there is the issue of logistics. How are we going to get our medicines, our food, etc., etc.? Because you can stop people and stop the spread. But whether we like it or not, human society as we know it has been changed by coronavirus.
True.
It's been changed forever, and we as a country need to look at 2 things. The president stated one thing, that a crisis is also an opportunity, and I believe that we should look at opportunity. However, if you fail to take the opportunities in the crisis, you are gone forever. So what are we going to do about the face masks? I think for me it's the lowest end of the scale. We are having sanitizers all around town, and indeed one pharmaceutical group did actually put out the formula for making sanitizers, something I disagree with. Because at the end of the day, you need to be sure that in the crisis, people do not unfairly, unreasonably, and unnecessarily take advantage of the public by providing things, quoted sanitizers, but we don't contain what it should contain, because that is false confidence. 2, we need ventilators. I mean, that is not in doubt. It's up to we, the experts here, now to say that, okay, looking at Ghana, 24 cases now, what is going to be the likely impact? Are we looking at 2,000 cases? And if it's 2,000, what is the worst case scenario? Our view, and indeed, Alfred, we have dealt with crisis. I have been at the forefront of dealing with the 2007 deworming crisis, where people were said to have died when they have taken medicine. That was just the day before Valentine's Day on 2007. Prof. Vinca knows it. We've done. Prof. Vinca and myself, 2005, how to address the nation on the malaria policy change. There were issues of whether we should take Queen 442 and all the problems. And we did give guidance, but consistently. And I would say it here because quite often in this country, things tend to take political colors. This is not politics. And what we are discussing have straddled both NPP and NDC governments. Ghana has experts, but our views are quite often muted till there is a crisis. And if there's a crisis, then we are kept back. And the view I make is that we, the experts, should really also shout. Because it doesn't matter whether it's just sanitation or traffic lights or Ebola or now Corona. Does Ghana have experts? Yes, we do. Too many experts. But how is the country utilizing these Ghanaian-created experts? All of us on this panel were paid for by Ghanaians. Most of us had free education. I mean, we had fun in school. Now, how is government, successive governments, how are they tapping this rich knowledge to drive the country? Really, it's about time. And there, I'll use my words carefully. It's about time we give more recognition to the knowledge which will transform our country. Post-Ebola, knowledge will drive the world. Right now, we should be asking, how are we going to produce our rice ourselves to move forward? Can we produce? Can our engineers come and sit with us and talk about what is the best form we can do an Aprotec ventilator or an Aprotec face mask? Believe it or not, supplies in the midst of the trouble. India says we are no longer supplying you 27 medicines. You will not get paracetamol in 6 months' time. Antibiotics, forget it. These are the 2-1. China is doing the same. The UK is saying now, even if you have it in the UK, you cannot do parallel export to other countries. In the crisis, we are on our own. And now as you drive through Accra, it's dead quiet. Ghanaians are panicking. But my plan or my view is this. We need to plan. We need to prepare. We do not have to panic. But if Ghanaians are not to panic, then the nation Ghana, the republic, must utilize Ghanaian expertise. I'll put my neck out and say we have the men and women. We can deliver.
I think that is never in doubt. It has never been in doubt. But you see, I pick up from the point that you make about the experts should keep shouting. I have an expert panel here. We're talking. But if you keep shouting and the person or the people who have to hear you are not hearing or give deaf ears to your shouting, you would only lose your voice in the end.
Alfred, listen. I mean, and I'm speaking as a political appointee. From that perspective. No, I will say this. You see, I was taken on for the Ebola vaccine and went to Parliament to apologize. Both sides of the divide, NDC and NPP, have taken advice then and now. And the reason why I put the responsibility on the experts is that Ghana needs technocrats who are willing to stand for the values they believe in.
True.
If we look throughout history, people have been bent to the stake because of their values. But if we're only going to talk and go for the country to look for us, politicians of both parties get so many advice from people whose motives are not the same as the experts.
True.
They hear a lot of noise. Now, which noise are they going to decipher? And I believe we, the experts, in the Ebola crisis, Prof. Vinka knows it. We realized that we, the scientists, shouted too much. That the then president really had to make a call. And nobody here will say they made a mistake. We will blame the scientific community for the stand we took, not the political operators.
Right.
So it's about time that the country rather says that, let us fund our scientists well. Let us pay them what they deserve. Let us treat them with the respect they deserve. Because now, in Ghana, a member of parliament is a honorable scientist, professor, who are you? So let us put our resources onto investments that will add value to our life and move this country forward.
Thank you so much. Professor Minka, let me come to you now. And on that point about post-coronavirus, knowledge and experience will drive the world. Let's move on from there.
So thank you very much for this opportunity, and thank you to the other colleagues on the panel. I think they've said a lot, and I will start first by saying that I think for all of us who get the opportunity to get involved in these things, let's, for the sake of the public, concentrate on what we have done, not what we want to do. There's too much, we are going to do this, we are going to do that. We are out of that phase. Preparatory phase is gone.
Yeah.
There is, the disease is here, we have local transmission, and what we are going to do has no place. In fact, if you continue in that scheme, then we've just lost the war. This is a war. And for me, when I watch other countries just crumbling, Italy, can you imagine the state of Italy and Ghana? The Prime Minister was weeping on television. So we should take this seriously. We are in a state of war. So I will come back to what Professor Dodu said. I'm happy the president has appointed Ezar. He's the general. I hope, like you said, he will be resourced to take us to the war.
Hope has never been a strategy.
Well, he has to develop his strategy, and he has to coordinate all these activities, and he has to move us forward. The problem with a general who has no resources is that you've made him to fail immediately. True. So when he sees the enemy, he doesn't have to come back to you to ask you which guns he should use to fire the enemy.
True.
He's prepared, he's ready to fire the enemy. So with that, I also have a little bit of problems. I'll come to your question, but I've so far been following what has been going on, and what I see is what is happening in Accra and Kumasi. I don't see what is happening in Ghana. At least the press should tell us. I don't see.
Well, that's true. I think it's primarily probably because of these areas having to be the places where cases have been recorded. And so you have the focus there.
So that is part of the problem. You know, in controlling epidemics, the preparation is the most important thing. Once you are into the epidemic, there is really no time. So by now, we should know what is happening in the other regions. Is it when the thing has arrived in Bolgatanga? I know there are 3 cases being tested for Bolgatanga.
Yeah.
So what happens? What are we going to do when all the 3 are positive? Then we start talking about Bolgatanga. So please, yes, Accra and Kumasi are the most endowed. They can take care of themselves as far as I'm concerned. But these other places critically need more preparation and more support. It doesn't need the same people who are doing it in Accra to do it in those places. But don't forget them, because the level of knowledge and so on in those areas will create a bigger disaster. You know, that's my first point. Please, let's see what is happening in the regions and not equate Accra and Kumasi to Ghana.
And to the extent that people are actually moving now to those areas, you know, with the fear that Accra is not safe. And we don't have any limitation on travels. So people are moving to their hometowns to go and be there for how long until this whole, pandemic is over.
Yeah. So secondly, there's the next point as an epidemiologist is that we are in the phase of containment. As you said, we are trying to contain the disease. We've put in some measures to contain this disease. But from what we are learning across the world, half measures don't actually give us an advantage.
True.
You know, if we have been bold enough, we've closed the universities, all the senior high schools, all the schools have been closed. Okay? We've closed the churches. I mean, can you imagine not going to the mosque to pray? We've gone all that strength, but we have left this loose. There are about 2 million people coming to Accra every day. 2 million daily. Our trotros are still packing people. Okay? Can you imagine one person who has a disease in a trotro in a bus? Then you see that our efforts are not getting anywhere. So half measures don't help. My description to most people about this disease is that there is something called a virus. People don't understand it. The disadvantage the virus has is that it cannot go from myself to Professor Dodu.
Right.
I have to carry it to him, or he has to get it from me. So human beings are involved in all of this. And at the moment, since there's no vector, our main aim is to stop me being able to what? Pass it on to Professor Dodu or Dr. Norman. Then we've put in measures in the beginning to stop the disease from coming. We waited. We didn't stop it immediately. We left it loose, and the disease has come. It's now here. Now that it's here, the dynamics have changed. The local transmission is something that we can't control.
We cannot control?
Yes, because the issue is that how do you know the people who have the disease?
As in patient zero.
As in patient zero. And most of those people try to follow them and find out who he has contacted in the last week. He might not remember that he went to church, he went to the mosque, he went to the market. This is completely a difficult thing to do. In fact, it's not only in Ghana that this is a problem. In fact, I think the Koreans are the ones that have done it the best. They use the telephone system to map out where you have gone throughout the time when they thought you had the disease, and then they use those maps to try and help themselves. That's something we should think about. But my point is that when we start having local transmission, it's a real problem. You eat breakfast in Accra, and you go to the funeral in the village in the afternoon. Okay, there's no big funeral, but there are meetings, and you spread it there and you come back. Sometimes you don't tell us that full history. So in the local containment, we have to stop it. We have to stop people from moving. Simple.
If you say stop people with me, you're complimenting the point about the lockdown.
Well,
to that extent.
So we have to have different levels of lockdown. If I am in charge, if I am the Tsar, Accra, Tema, Kumasi, I'll lock them down completely.
But then you would have, so if, for example, those who move foodstuff from the food basket or areas, there are other routes that they can get into Kumasi and get into Accra.
Yes, a lockdown, unfortunately, in our kind of circumstances is very difficult. It's not like in the US or in Europe. But I will not allow those trucks that are coming from Kumasi into Accra and from the villages. So they will be outside the outskirts of town, and we will find means in which we can bring the food in
the areas where there's been the lockdown.
Yeah, because they can come all the way to where the lockout is, and then those other arrangements can be made, and that's a whole discussion. But once that lockdown is there, I won't see the trotro going from Medina to Accra. So that's done. Number two, why I prefer this approach is that we need to enforce the lockdown. And I don't think we are so organized and we have the people to do that. So we start with the army and the police in Accra, Tema, lock it down, learn the lessons, apply it to Kumasi, and then prepare to move it to Takoradi, move it to Tamale, and so on. But I won't lock down Ghana. I'm talking about a phased lockdown. We learn the lessons because this is something, there are certain peculiarities that are akin to Ghana.
Okay.
And that we have to learn. What the US or Italy does might be good, but it's not as nice as we have our system, our road networks and so on. Yes, there'll be a filtering of it, but I think if you really put a good lockdown, you can get 80% of the people completely locked down. You deal with the 20%. We cannot get 100%. If I get 80%, I'll be so happy. And I'll make sure that that number of contacts will reduce immediately.
So I'm looking at a situation where, for example, you say that there should be a lockdown in all of these areas. How are people, going to cope? I think that there's that element of discussion as well, where I've had people make that kind of proposal. But then the conversation also is that within this period, when people haven't prepared, is government ready to now step in and fill that gap of providing food to people at certain points and be able to meet those basic needs as we speak?
So the issues are also, you have to look at it from the consequences of inaction and taking the action. There's always an opportunity cost in all of this. It's not going to be perfect.
True.
People are going to have many problems, but there is a point where the people will not tolerate what the government is doing. That is, if we get overwhelmed and people are sick, they can't be treated anywhere. In fact, we can't afford to treat more than 500 cases.
We can't treat more than 500 cases?
Where are you going to treat them in Ghana? How many ventilators do you think this country has?
How many do we have?
I don't know, but I don't think it's more than 150. In fact, I'm not being conservative enough. If I'm conservative, I'm sure it's about 100.
In this circumstance?
But you tell me, where is it? That's why information must be flowing. And where are you going to buy it now? The great America is struggling to find ventilators. It's ordering companies to prepare to make them. We cannot make them. So we are not in that position to get there. Secondly, I mean, this leads me into what we should do to deal with the problem. So I'm telling you that if you don't lock down, you get too many people who are sick and you have no way to treat them. Now, when we come to treatment, what we should be doing now is not this piecemeal effort. In fact, when you don't have much, that is when you put things together. You know, Rich has some few beds, he's doing his own thing there. Tema is doing something, then Kolebu is doing something. No, this, I don't think people have seen what this is all about. This is a war. The war is that...
We really appreciate the quantum effect of what this could be, you know.
But we are seeing it on the television, we're seeing it on the videos. Look at Italy. Look at the lineup of the army just carrying dead people. They can't even cremate them. Impossible to cremate them. So we are not talking about a situation where it's so easy. What I'm saying is that we haven't got the capacity to deal with the very ill people. So when the sickness comes, there will be the mild illness, and then some will recover, and then some will go, about 5% of those will go into severe illness. That is what we need to think about. I would prefer bringing our resources together than spreading it. Because, first of all, when you spread it, all those hospitals where these people are going, there are sick people there. Those sick people will get more infected very quickly.
True.
Because their immunity is already compromised. That's why they are sitting in the outpatients. So I would prefer, for example, if I was running this, and my advice would be, the Legon Hospital is there. It has...
You mean the University of Ghana Medical Center?
University of Ghana Medical Center is there. It's not been fully functional, but this is a place where the government can say, now I've built a 400-bed hospital. It's there. I turn it into what? An emergency place linked to Noguchi. Beautiful. The testing is there. The hospital is here. In Accra, we'll start to build the capacity there. And if it gets overflown, I will. If it gets oversubscribed, I will think about Dodowa. But what happens is that, I think this point is so important. I'm not going to do business as usual. Not every nurse and every doctor is put to look after these people.
True.
These people will be chosen, taken from these places, and it's like for them going on to war. In fact, I will not let them go back home. I will put him in one of the hotels nearby. They will live there. They will be provided food. They will go to work. They will perfect all these procedures. And you are sure that when sick people arrive there, they will do something. Second, I will have enclaves in Kumasi. I won't go for Konfanochi. I'll go for the University Hospital with KCCR. And in all these places, be careful. The other points I'm trying to drive at is that when I take the University of Ghana Medical Center for the very sick people, the people who are not so sick, I'm going to put them in the hostels.
Okay.
The student dorms.
Just to avoid any transmission and to
look,
aggravate
we
the
don't
situation.
live in a situation in Ghana that allows us distance spacing. When I hear what do they call it? Social
distancing.
I mean, if 10 of you are in a house with 2-bedroom.
Absolutely. So you have a compound house where you have 10 people with their families and children.
Yeah, so what is social spacing? Social distancing. No, if that person tests positive, and that's why we must be tested, I will remove him straight to that big enterprise we have there. You've closed the university anyway. The students are gone. And in the next 1-2 months, we all have to make sure that we can tame this. So you can create these enclaves in Legon, in Kumasi. I'll do, Kumasi will be backed by Agogo, if you go and look at the facilities in Agogo. And then for Brong and Hafo, in the northern regions, I'll look at Kintampo. I'll remove all the patients in Kintampo Hospital and send them to Titechima and create that place for these COVID cases. I will go to the north. Tamale, the teaching hospital, would not be the ideal place because then you cut out all the facilities for treatment for other people. Within that place, in fact, the best place in the north will be Navrongo, where I used to work as the research director. The lab is strong. I will move all the patients from Navrongo War Memorial Hospital and I'll create that place and I'll bring people who have been trained and who need training. They are going to stay there for the next 1 month, 2 months. You will pay them money to be able to cater for their families when they are away. It's just like going on a 2-month postgraduate training in the UK. But the UK happens to be Navrongo. So you each of these groups are going to be working out their strategies on how, when patients are brought in, how they are going to deal with them. This is so critical. You know, this piecemeal activity is not going to take us anywhere. I mean, Ridge has 5 beds. Okay? So, I mean, you want every nurse and every doctor to be able to get involved in emergency care. No, it's not going to happen. That's why there are such
And maybe one major concern that these frontline health workers have had is the lack of personal protective equipment.
Exactly.
They don't even have them.
Yeah.
You know, so to call them to even to order or to call them to duty and have them committed to the process, also thinking about their lives.
They have to. They have families. And as they leave every day and go back home, they put in all those family members at risk. So I will put them there and we then enhance the referral system. If somebody is found, those centers will be taken care of. Who is the same place in the Volta region, the whole teaching hospital. So what we build in those teaching hospitals will be there for the next epidemic. They are not just created in a vacuum. They are tied to institutions that can be developed. The research component can be added.
Yes.
And the information collection will be perfect.
And that's the point that Dr. Bampo made about we having a futuristic approach to this, so that in as much as we'll be putting measures in place now, it is geared towards those measures actually being improved over time to address any pandemic or whatsoever that will come up in the future. And viewers, look, these people that we have in studio, as Professor Dodo made the point, there are experts in this country. We have gone out of our way, assembled them to have this all-important national conversation so that they can suggest their solutions to where we are now. It's a critical position that we have or find ourselves in as a country, and as you have been talking about, we need to be able to paint the real picture. I think the most important way we can deal with fear is put out the facts and the figures, and not managing information, and that's what Doc, you've been talking about so far.
Sure.
Have we done that enough?
No, I think we are approaching this whole COVID-19 event as if it's a national security crisis, but it's a health emergency. The skills you need for national security are different from the skills you need for health emergency interventions. And that's where the confusion is coming. And because of that, as you just said, hospitals don't have PPEs, nurses don't have PPEs, allied health people don't have the PPEs, doctors don't have the PPEs. I mean, what are we doing? We had lead time when COVID-19 broke out in China in December, in January, in February. We haven't done anything in March. We're just making regulations. You cannot manage actual disease outbreak with just the laws. The laws are beautiful. You need to have them. But what you really, really need to have are the logistical supplies for doctors, nurses, allied health people to do their job well. And then the rest of the society, health promotion, you need to get them informed. And one of them is to be totally transparent. I don't think, as Prof. Binka said, when people start dying, I don't think it's going to be so easy. We have a history of local vigilanteism. And the moment people start dying, the moment you are in a community and you are fingered as having been, having the disease, they probably will stone you to death just to end the spread of the disease. But in that process, the disease will actually get really, really nasty on us. So I think government is trying its best, and I'm very, very glad that Dr. Asamoah, man of great experience internationally, can transition into the local situation with his international experience. I don't know how he's going to coordinate, work with the doctors, the hospitals, and the nurses, because sometimes if they don't receive you well, your instructions won't go very far.
True.
So there is a lot of community involvement, community knowledge he has to learn and make sure the people receive him well. But government has a tall order ahead of it to really bring this disease under control. Otherwise, we'll get to the position of Italy and people will die.
Hopefully not. Hopefully not. Well, I think we've hinged our strategy on hope prior to, the disease arriving in this country. And that's the point that you made, because in February, you were here in this same house and painted the picture as it was, but we were just hoping. I mean, the language then, prior to the disease arriving on March 12, was that hopefully it won't get here.
That's it.
And so the planning really wasn't in place. Dr. Bampo, 50,000 test kits are expected to arrive. I'm going to come to that. But do you think that we planned and we prepared enough to be able to deal with the panic?
Well, I think you said it all. Hope is not a strategy. And for me, what I want to see is that big picture plan that Prof. Binka and Doc were talking about. So what are we doing in the three areas that I spoke about? Okay. So let's talk about getting ourselves ready to manage cases. If you look at it in the short term, I think Prof outlined a certain very nice way we can look at it. In the medium to long term, we know that we don't have the facilities. I remember that in 2014-15, we were building health facilities that were going to add 6,600 beds. Where are we with that? Where are we with actually opening those facilities to give ourselves more latitude, more room?
The CHIPS compounds, maybe.
All those things. Where are we with that? Where are we with continuing the infection prevention and control and the training of the health workers that was started when Ebola came around? Because merely having PPEs doesn't mean that the health workers can actually don them and doff them, can put them on and put them off. Because that's where, so you need to be able to, I remember when we started doing the work around Ebola. I started working, I think, June of 2014, and I remember from Kolebu, there were some health workers who said that if Ebola comes in, they would run away. By the end of 2014, we had 42 Ghanaian health workers who actually left their families, left Ghana, and went to Sierra Leone and Liberia to help. How was that done? It was done by giving them information, giving them the proper training, making sure that they were confident enough to deal. And that's the way it is. You need to equip people with the requisite information and everything else so that they have the confidence to deal with it. So I want to see a plan, like I said, based on these three areas. The case management, based on public education, based on how we screen the community, make sure that we find cases. Because for most of the countries that have done well, they've done something called flattening the curve. No matter what we do, people are going to get the disease. The good thing about this disease is that 81% of people would have mild to moderate symptoms. 14% would move on to becoming severe, and then the rest, the 6 or so, would be critical. So what we want to do is to make sure that it passes through, and we have something called the reproduction rate. So every person who is infected stands to infect about 2 or more people. The epidemiologists are here. What you're trying to do is to make sure that you reduce that number from them infecting 2 people to maybe 1 person. So instead of getting to a point where the disease rises so quickly that you have so many people, in fact, Prof mentioned it, if we even have 100 people who move into the severe or critical, we don't have the ventilators to deal with them. So you want to get to that point where you have fewer than 100 or fewer than 40 or fewer than 30. So I think we need to stitch together a comprehensive plan that says what we are doing in the short term, what we are doing in the medium term. But for me, most importantly, this discussion will be over. Nobody knows. 6 months, 9 months, whatever. What would we have learned for the next episode when it comes 4 years down the line, 6 years down the line? That's my main admonishment.
As a main admonishment, and really that is the focus that all my guests in studio have been talking about. And if you just tuned in, this is our expert panel discussion. You can call it a town hall that we're having, a virtual town hall with lots of thousands of you out there who are watching us. Dr. Ishmael Norman is with us in studio, Dr. Victor Bampo, Professor Alex Dodu, and Professor Fred Benka still with us in studio here, having this all-important conversation. Your thoughts, views, comments are welcome. We're highly interactive. As I said, this is a virtual town hall. So we're connecting right now to Iowa, where Dr. Sewa Ayi is an advocate for a total lockdown in Ghana, and she's joining us on Skype from Iowa. Thank you, Doc, for your time. And first of all, tell me what's happening where you are.
The county I am, there's so far two infected patients, and in another university hospital, there were 29 people who tested positive. So everybody's a little paranoid, and around the U.S., currently every single county and every state in the United States has disease. And so now there's nothing like which place did you go to. It's everywhere. It's in the air, and anybody can catch it at this time.
So how are you then coping, especially now you know there's a local transmission now. So what is the strategy being employed there? I'm sure we can take a few lessons here.
Okay, so well, in the United States, the states that are most affected, New York,
Right on. So if you just tune in, you're still live here on our conversation. This is our own town hall. It's a virtual town hall, or the expert panel on the coronavirus. And we're taking it from 3 aspects as we've been having this conversation for the period. Lots of you have also been joining in with your thoughts, your views, and your comments. Yes, I lost you. Sorry, Dr. Ayi.
Yeah, I'm saying that in California, there were so many people on the beach. It seemed like they didn't know that we had a pandemic going on. So yes, cities and states are locking down, and I hope it spreads to most other states, because that's what we need. Otherwise, very soon, America will become like Italy.
Wow. America will become like Italy. And you're advocating for a total lockdown with your assessment of the situation and what's happening here in Ghana. Should it be the case that it should be gradual, or we should just go ahead with a lockdown as some of my guests have been proposing?
Well, I mean, I have been advocating for a global lockdown, not just in Ghana. Global lockdown, because what I've noticed is that in the end, people go on lockdown anyway, but by the time they do it, it's way too late. And this morning I was sharing with some of my listeners about Italy. Italy went on lockdown on March 9th. And on the weekend of March 1st, I was anxiously calling a lot of people. I actually wanted to get one of these things that people sign up and say Italy should lock down, because I could see the trouble coming. Hundreds of people were dying, and they weren't going on lockdown. And by the time they went on lockdown, it was too late, because February 21st was when they recorded their first death. And at that time, there were only 3 patients. So my point was, between February 21st and then 18 days, look at us. Today, like, 700 people are dying every day, and it's a testament to the fact that this thing works exponentially, and public health officials need to inform the politicians, people who are in authority, because most of the time it will seem like you're overreacting. Like Ghana right now, we have 24 cases, we've had 1 death. The fact that 1 person is dead should be like a red flag. Let's lock down. That is the stage at which many people are going to be in that 14-day period. They have the disease, they're going to the beaches, they're going to the markets, and then in 3 weeks, suddenly everybody's ill. Everybody's coming to the hospital. You don't have beds. So if you know you don't have beds, this is the time to lock down. I mean, Italy has a bed to patient population of 3.2 to 1,000. It's more than America. America's bed to patient population is 2.8 to 1,000. Both countries are suffering. We don't even come close. We are like 0.9 to, I don't know if it's 100,000 or 1,000. We don't even come close. So you immediately have to assess and realize that, look, if I wait for 3 weeks and I have hundreds of patients, there's going to be total anarchy. I mean, you should just watch the videos of these Italian anesthetists. One hospital, he said they have 1,000 anesthetists. I don't even know how many anesthetists we have in Kolebu, much less the whole country. If we wait for 3 weeks, my friend, I'm telling you, it will not be pretty. And I know nobody's paying me to do all these announcements. I'm like, I love my country. I need to warn somebody that with 24 people, it means that really we have 120 people infected. And every 3 days, that is multiplying. Every 3 days, that 120 becomes 240, 240 becomes 480, 960. I mean, but we don't see it because they're all happy, lucky. Some of them are in that 80% people who have mild to moderate disease. And then suddenly we would see the critical ones. They are short of breath, heart rate and respiratory rate is above 30. They're suddenly coming to the hospital. Doctors are overwhelmed. I mean, I just don't want us to get there. And I know people are saying, oh, what about the market women? What about money? But look, there's no amount of money lost that would be compared to the loss of lives if we sit down quietly and don't do a lockdown. It's not just Ghana. Everybody, I'm watching Trump, UK, they're all dilly-dallying. I'm like, look, if you don't have examples, you are excused. Look at China, look at Italy, look at Spain, and sit down and be doing, we are waiting. When there's a fire, the firemen don't just go in traffic, oh, we're waiting. They do ping-pong, ping-pong. There's an emergency, and we are not seeing it. We are not seeing that we have an emergency. I'm sorry, but that's how I feel, and I won't change my mind.
Well, as a matter of fact, Dr. Aye, you're not alone in this feeling because almost all my guests in studio align with the same way that you're feeling right now. But, I mean, look at what the president talked about in its third address. He says all borders, lands, sea to be closed to human traffic from midnight on Sunday. Ministry of Health to trace and test all contacts. 50,000 test kits ordered. I mean, you're recommending this total shutdown or lockdown. If people start reporting in droves to these health facilities, and you make the point that we don't even have the beds to deal with them, is case management a strategy to adopt here so that, I mean, you wouldn't lock it down totally, but manage it at a point where, you would have, a small number of cases being recorded over the period, then you would be able to deal with the situation as it comes. We lost contact with her. We're going to reconnect with her in a bit. But it's a very, very serious point that she makes and the global picture that she's painting. Let me just say that she is a disease that's a specialist just joining us. And let me just, she's back again. Dr. Aye, I think I lost you at a point. Yes. So
yes, I noticed that.
Great stuff. So now you're making that point about a lockdown. I'm saying that, will a case management process be a strategy to employ, considering the fact that we don't even have the beds and the facilities to be able to deal with the cases if they come in droves?
Okay, so there's two things. Number one, we should have shut the borders 3 weeks ago. See, there's 2 stages. One, if you don't have any infection, you don't even have to lock down. We didn't do that. We waited till last weekend, and I applaud the authorities. We've locked down, we've closed the borders. But the problem is now you have the infection in your country already. So the borders is good, but now you have to go to the second stage, which is people are spreading the disease. You know, they've divided this outbreak into 3 stages. The first stage, you're trying to contain it. Unfortunately, we didn't contain it. Now we have human-to-human transmission. So now we can't wait for case management. The point is, we don't have what it takes. Even before COVID-19, we have 3,000 doctors. I'm part of the problem. We're not in the country. 3,000 doctors taking care of 30 million people. We are already understaffed. I mean, if you go to an outpatient, you wait and wait before you see somebody. Now, when there's an outbreak, I mean, just look at cholera. Just 3 years ago, people were walking in garages with poles, and cholera was not, I mean, cholera is bad. People can lay down, but they're not actively like dying. This one, you're going to have people coming in with septic shock. They're breathing fast. The families will come in desperate. They're dying. You don't have we don't even have enough critical care physicians. So it's like you quickly have to assess, okay, A, B, C, D, this is what I'm going to need in 3 weeks. I don't have it. Let me do whatever I can to stop it, because the third stage will not be good. I mean, case management is good for the 24 cases, but if we can just retreat into our homes. I mean, I want us to look like the streets of California right now. There's nobody on the streets. Nobody. Everybody is in their home, and it's being enforced. You need something. We have to find a strategy, and we have to throw away all the excuses, because in 3 weeks, it will be too late. I know if it happens, then we will go on lockdown, but it will be a useless lockdown, because even the people in the homes will be transmitting to each other in their homes.
Doctor, I want to thank you, but kindly hold on for me, because Professor Dodo wants to make a point on one of the issues that you raised. You did not agree with her on the closure of the border, which should have happened 3 weeks ago. I think, Dr. Newman,
good afternoon, for you. Doctor, I think it's very important as we begin to fix this, to first and foremost start and say, what do we want to achieve as Ghanaians? We want to solve a problem confronting Ghana. Solving that problem starts by looking at the resources we have as a country, across board, and saying that how do we use these resources to solve a problem? Right. We've all known the problems of Ghana, no bears, no this, no that. We know that. That is good. Now, what is the way forward? For starters, I've stated that the president has been clear enough to come out once, twice, thrice, and has promised to come out to help. Number two, to secure our resources, he has on 2 occasions, just in the past 8 days, met various sectors, the pharmaceutical industry and all other industry, that how can country Ghana move forward should we have a lockdown. These things have been done, and I appreciate the call for more resources, for more this. I believe that all of us in this room and the sweet doctor, what now we have to do is not to say we wish the authority will. We will have to take leadership. And what does that mean? Right now, when there is a lockdown, should there be a lockdown? We cannot say we don't have options. We do. In the attempt to digitize the economy, we now know that, yes, people can use whatever GPS and contact people. That's number one. But let me come to the main one. Let me come to the main one.
Not to interrupt you, I'm so sorry for this, but you know the problems with the GPS.
Let me give you the...
I think the GPS...
Let me give you the nitty-gritty. Forget about the GPS.
Now
we are health workers here. All of us know what it takes to solve a problem. We know the number of beds we have in Tamale, in Kolebu, in this. We know the number of ambulances, the number of resources. It is about time we begin to ask, how can we use the resources we have? It's easy to just throw up in arms and say something is not being done. I hold the view that Provinca, myself, Dr. Bampo, we are part of the solution. In fact, all of us on this channel, and we should not, none of us here, including the media, should be speaking from the third point. Ghana is at war against a virus.
Absolutely.
That virus has no color.
And I think that's clear.
Our solution should be that this is what should be done, not if this were being done. That is a third-person approach. I think, really, as health leaders, especially, and as leaders, any solution which comes from, if this were done, offer it. And if the country says we are not going to take it, because you see, the country must change the narrative. The narrative is that here is a problem we have. I love what Fredrinka said. Fredrinka said, if you look at Tamale, we know how to go to Navrongo. If we come to Accra, if we go to Ho, and most of us here, at least the health makers here, we are so intimate with those on the field that we should be now moving from just a panel from here to rather solving it. And the only way you solve it is to come to an agreement that as a country, this is what we want to achieve.
I think I can agree with you to that extent. But how do we solve it, or how do people hook onto this clarion call when, what they need to actually help solve the problem is absent. I think we also need to acknowledge that point, because you made the point that we know where we are in terms of the resources we have as a country. So if you are making the clarion call, there must be another call to the other side. Put what we need in place to be able to enable us solve the problem. I think that's a fair call. Yes, but Doctor, you want to make a quick response, and then we can let you go.
I think maybe we're not used to a total. We can even do a partial one. For example, people who work in the bank, people work in places where they can do their work from home. Can they go home and do their work? But at this point, until the government mandates it, one individual in an office cannot just say, well, today I'm working from home. They won't get paid. Yeah. But if we, from a policy perspective, if we make a decision that, look, currently Ghana is on stay at home as much as you can policy, then employers would feel empowered to allow their employees to stay at home. Because at this point, we don't know who is incubating the disease. I may be talking to you at the office. You look nicely dressed in your suits, but now we've realized that from France and America, we realize that politicians, everybody who looks nice and smart, can be incubating the disease and passing it on.
I agree with you,
partial possible.
Great. Thank you so much for connecting with us via Skype. Dr. Bertha Sewai, infectious disease specialist, who is in the U.S., actually Iowa specifically, giving us the situation there and also a global perspective. It's grateful. Thank you so much for joining us.
Thank you.
She joined us via Skype, and it's a point that she makes about the fact that we have to be clear about the strategy. Where are we going? I think it complements everything that you have all been talking about. You want to make a quick point, and I'll go to Prof. and then Dr. Bampo, please.
My point is very quick, and I want to thank the doctor for coming in with the inputs, and indeed, I want to thank TV3 itself for raising this. What I just want to throw in so that my august colleagues will also add is this. A challenge you always face in the liberal democracy is going down to take action. And we've all known the left and forward about the bill which was sent. Most of us believe that more draconian steps are needed. But how do you do it within a setting where you avoid any thinking of the fact that either it's too far or it wasn't legal or it was meant for other purposes other than intended? I don't have an answer on that. Okay. I have no intention of raising that as an issue. What I think is that we should be contextual now and probably make a bold call as health experts that this is what should be done, rather than leaving that side, because we live in a country of laws and we just can't do that.
I think it will be good also to appreciate the extent of the problem, because I mean there's a case of a 35-year-old who returned from France who is showing no symptoms of the coronavirus but actually tested positive. So, I mean, even the symptoms and the case management or the case definition in itself is something that we have to look out for again. Mm-hmm. Because really, if you're not showing the symptoms, and actually then the community, transfer or these cases makes it a lot more difficult to actually trace contacts. Dr. Bampo, and then I'll come to you. Prof,
okay, no, at the risk of sounding like a broken record, I think what Prof. Dodo talked about is very important. Coming up with some kind of costed plan that we can then test. First of all, I want to say congratulations to Bertha. We were in the same medical school together. So, and we're on several fora where she's doing so much to provide information, and I'm really proud of her. The second thing is that she talked about Italy and so on. I think even just amongst those of us in this on this panel, talking about putting a plan together. Why is Italy in this space right now? Because the northern part of Italy, where they have a big problem, the Lombardy area, is where you have your fashion and garment industry. China provides very cheap labor. So there were about 100,000 people from Wuhan in that area. And like she said, it's very true. By 31st December, there were 2 people who were ill. They were taken to the Lazzaro's Spallanzani infectious disease unit. And then by the 6th of February, they had gone to 3. But because they had this base of people, it was quick. It was quick to spread. Right. So what probably we must do in Ghana is to have the epidemiologists like Prof. Binka and co. Let us have that costed plan. Mm-hmm. Let us try to put scenarios in place. How is it most likely to spread? Let us have those scenarios. And most importantly, and you mentioned it, let the resources be made available. The $100 million that the president talked about, is it there? Is it not there? Do we have it? You know, so that when we have a costed plan and scenarios and we have the resources, we can change it if things don't work according to the plan. Right now, what we're doing is we have a piecemeal approach. So we've shut down this place. We're doing this little one here. We are doing this other one here. Where is that big costed plan, which we can then test and actually change the direction if it's not going according to plan?
Obenka.
Yeah, so thank you very much. I think I'm following on the same route. I'm also very much interested in what Betha has said. I think she realizes that going straight on a total lockdown in Ghana, we will struggle a bit to try and do that because there's no point blocking the whole country down and not being able to enforce it. So I will suggest that we start with the big two places. In fact, the local transmission has been in Kumasi and in Accra. My information that I have that makes me worried is that part of this transmission will soon start showing up in the densely populated areas. And when it does, there will be no peace. So block it down. I'm not going to tell you the exact place.
I'm going to ask you.
Yes, I'm describing what I'm talking about.
The densely populated.
The densely populated areas.
In these two regions, Accra?
In Accra.
Greater Accra and then Ashanti region?
Especially in Greater Accra, I've heard some of those information that some people within the densely populated areas have got the
symptoms?
Yeah, they've got the symptoms and samples have been taken. Very soon we'll start seeing. And that's the other part of the story that we don't get. We struggle to get information. When the person is positive, tell us which area. Because it's important for people to know where the areas are. I'm not saying call his house number or his name, but you have to know where the thing comes from. I mean, this kind of thing just doesn't help anybody. That's one.
You know, it's not about spreading fear.
Yeah.
I think the only way we're actually spreading fear by keeping away information.
Yeah.
Misinformation leads to panic.
Exactly.
I think that kind of communication has to go out there. And Prof. Dodo, you're close to government, so I really need to understand, maybe as we go on, why this is the case. Because if we are spreading calm, not fear, we can only tackle fear with facts.
Yes.
And not, withholding information.
Yeah. So going on from there, what I would suggest is that we as a panel must agree that we are proposing a partial shutdown, Accra, Tema, Kumasi. As for the money bit, our president, His Excellency, has allocated 100 million. It's the finance minister's job to borrow the money from wherever he can internally and get this going, because the lives of those people, he cannot be responsible for them. There's nothing called there's no money. There's 100 million in this country. We have to take that money from wherever we need to take it from, and we can put it in when our loans, where the loans we get come. But you can't deal with this problem just by saying so. So what is happening now is that the government is issuing instructions, the ministry is issuing instructions, nothing is happening. That's why I keep on pushing about the regions. You ask them to start the committees, they should educate the people. How do they educate the people? They have to buy fuel. They have to meet. Where is the resources? You all know that in this country, first quarter of every year, civil service money doesn't arrive.
True.
We know that. Is that a secret?
No, it is not.
Yeah. So why did you expect that this money would have come January to March? We are in March. All these places have not received any money. So let's not be pretending. Send the resources. Let the Honorable Minister tell us how much he sent, PPEs, masks, and all this. And don't stop. Let us not sit here and say, oh, we are prepared. I used to hear them, oh, we are well prepared when it comes. People have not been trained. People don't know how to use these things. So how are you going to do that? We've done no simulation exercise. That was why people ran away in Kolebo. There's no simulation. You have to simulate the thing so that when it arrives, everybody knows what he needs to do. This is simple. It's as simple as that. All other sectors have a role to play. They all have a role to play. Can you imagine if we had tasked the universities and the schools to do the education? By the time we closed the schools, they would have been back in the villages with the message. We didn't teach them. And we closed down the schools. They have gone home.
opportunity missed.
But you agree that information management could have been better?
It should have.
I think listening to what Prof. Binka is saying is this. All of us now are getting to a solution point. I believe that there are a few key things which should come out. And we've done this for other countries across the world. Yes. Prof. Binka knows it. Where we are now getting is this. We are not beginning to sign a pact, a compact for this country. We are leaders. And almost certainly after this program, Prof. Binka, myself, and Honorable Victor definitely will be calling Nasamwaba and saying, AB, now this is what the country thinks. And I think what TV3 is doing is great. Now moving from there, knowing that just provision of knowledge is not enough communication, what is the format? And we have to guide the country and say, look, on a daily basis, these are the things we must know, because that helps all of us. Because in the absence of that, you have too much noise and very little consistent, single, authoritative source of information to the country. In fact, when you go on social media, it's all sorts.
Great point.
But we are going to direct that now. From here, we go to, and I think you must hold us accountable, because all of us here are leaders. And we would approach AB and say, AB, can we tell His Excellency this? Now, this is what, as experts, we feel should be the consistent daily information, twice a day, thrice a day. When you do that, and that is not given, then somebody's failing.
Can I add a little bit before you go?
I wanted to actually go for a quick.
This break. One just leads to this.
Maybe very quick.
Look, before the president's announcement on Sunday,
Saturday,
the
third one,
Saturday,
yes,
I can assure you the country was prepared for a shutdown.
Yes,
it was the minister who came and said there will be no shutdown. I mean, how? We were prepared for a shutdown. The noise was all over. Everybody knew the president was coming to shut the place down.
And Dr. Norman make the point about a voluntary, shutdown of a sort, with people actually closing their shops. I'm going to come back to him on that as we do an assessment of the security situation. I'm going to go for this quick break. We'll be back shortly. This is an expert panel on Ghana's situation report on the coronavirus outbreak. It's a virtual town hall meeting. Join us with your thoughts. We'll be back shortly.
Accra Institute of Technology is a top-notch private university in Ghana. The university offers world-class bachelor's, master's, and PhD degree programs.
IT and management is one of the good courses I think we should offer these days, because I realized that on my years of experience on the IT field, I realized that IT guys find it very difficult to cope with the management aspect. And AIT is giving us the opportunity to do IT and management. We dive into what? Programming. I did HR, I did principal management, and all this one is giving me the opportunity to be able to communicate with my manager. So when we are talking about IT, I know that I'm talking about something technical, and I can also talk about management, which is also another dimension of corporate institution. So with all this, I think AIT is giving us a very nice opportunity.
We are AIT, the University of the Future.
The world is in very dangerous times. COVID-19 is here. The World Health Organization has declared it a global pandemic. And so Media General wants to entreat you and yours to stay safe, to stay healthy, and to observe hygienic processes.
Ghana has recorded some cases of coronavirus, and it is advised that you don't touch your face, your ears, your nose, and your mouth with unwashed hands. Wash your hands with soap and running water.
Cover your cough or sneeze with a tissue. When you're done, dump the tissue in a bin.
These are not normal times, and I'm quoting the words of the President of the Republic of Ghana, admonishing all of us to stay safe as we record cases of coronavirus in the country. We here at Media General are encouraging you to stay home when you feel sick.
Every life matters, and that's why we cannot afford to lose a single one of you. It's very simple. Just adhere to the directives given by the WHO and the Ghana Health Service. Let's stay protected, let's stay healthy, and let's drive out coronavirus. See you on the happy side.
How we will get there, but we know we will.
What you need to know about the coronavirus infection in China. What are the signs to look out for?
Present to fever, general body pains, cough, and the difficulty in breathing. And there are a lot of other disease conditions that have similar presentation. So engagement and encounter with somebody in affected area is very important to say that it is part or fits the definition for suspected case. General population about the areas affected, and you mentioned China where it started. Thailand has confirmed case, and the UAE, and then so all those countries, if anybody is coming or going to such an area, then if it is not very, very essential, you have to think about whether you have to go or wait for a while.
How can it be prevented?
You have to make sure you adhere to good personal hygiene. Hand washing with soap and water, so that if for any reason you get to contaminate yourself, you would have the opportunity to wash away the contamination before you touch a sensitive area which is likely to transmit the infection to you. There is no specific treatment.
As the disease spreads to other countries, Media General encourages all to adhere to the advice from health authorities to stay safe.
Welcome back to our conversation. I call it. It's what we have described as an expert panel town hall meeting. It's a virtual one because normally, if you've been following our expert panels, we have guests in studio, but the times require that you join us virtually. And it's been amazing the kind of response we're getting on our various social media platforms. TV3 Ghana on Facebook, DSTV channel 279, all across the world on 3news.com. We're live as well on 3FM 92.7, Onia 95.1, and Connect FM in Takoradi, Akoma FM in Kumasi as well. And we're grateful. I'm going to go to your messages on all our platforms, but I still have with me in studio Dr. Ishmael Norman, who is the president of the Institute for Security, Disaster and Emergency Studies. Also with me in studio, Dr. Victor Bampo, who is a former Deputy Minister of Health and Coordinator of Global Financing and Technical Support of UNAIDS, and actually was one of the major focal persons in Ghana's battle that's against Ebola to ensure that we do not have a case as at the time. And then also Professor Alex Dodu, a clinical pharmacologist, director of WHO Collaborating Center for Advocacy and Training at the University of Ghana, and the Director General of the Ghana Standards Authority, and Professor Fred Newton Benka, who is a professor of epidemiology at the School of Public Health, University of Health and Allied Sciences in Ho. And also all of them, especially all the three medical persons that we have here, have been involved in the management of epidemics at one point or the other in this country and actually beyond. And also Dr. Newman as well, who's given lots of expert advice to many countries across the world in dealing with situations like this. Dr. Newman, I want to come to you at this point before we go on to our viewers on the situation with, I mean, we're calling for a lockdown and all of that, but I mean, it's pretty easy to want to make that proposal, but you would agree that it will be difficult to implement. I mean, if we get to that point.
I don't think so at all. I think, Professor Dodo, with all due respect to you, you're making the intervention sound like it's a clinical problem. It's a social problem and a medical problem. So it's not only medical people that will call Asamoah. He's from my hometown. I can also call him. So don't make it sound like we have exclusive relationship with him.
Apologies.
All right. Thank you. That is clear.
Serious apologies.
All right. I think even countries with higher GDP have been able to shut down some portions of the economy.
Right.
I don't see why we are dilly-dallying on this thing. Because what is money when people are dying? And we will get there. And I don't want us to get there. So Dr. Ayi, her advocacy is very, very strong and in support of everything that we've been saying here. I think we should move away from the politics because I hear a little bit of political ting in some of the submissions that are being made here, and I don't like that, because this is about public health pandemic. This is about public health intervention of pandemic. The politics should stay back and let us look at the ways and means of how we can handle this situation. I think the shutdown should have happened weeks ago.
Weeks ago?
Yeah. Because then the containment would have been better managed.
Does
right
the shutdown
now,
consider the number of cases a country has recorded? I mean, there are 24. Dr. Mampo.
You see, that's what I think the shutdown is important, but like I said earlier, it must be guided by the epidemiological evidence.
Okay.
So the shutdown is nice, but it's done for a reason. We're trying to reduce people's interactions so that the disease doesn't spread. So it must be guided by where is the disease in Ghana coming from, in which direction is it moving. So that's why it is important for us to have it done with the benefit of epidemiological guidance.
But you know, at case 16, that was on Friday, we had 399 contact persons traced. At case 23, active, we're talking about 600, which I think is woefully inadequate. So where do we go from here? I'm sorry I interrupted you, but I still want you to take on that point, and then I'll come to.
No, I just wanted to explain something to you. Please, those figures, be very careful how you use those figures. It's the same thing that happened in the United States.
Right.
We are not testing enough. So how do we find the disease? You can find the disease without testing.
So if out of the abundance of caution, people show up, they want to test, can we meet that demand?
That's what, so you should take the figures. When the United States started testing, they added 1,300 cases the next day. Because people are dead, they have to be tested. We have 350. How many of them have been tested?
Also,
so remember that the number who get positive, like Dr. Bampo said, then determines on the numbers they can infect by the day. You know, so if you don't get that correct, and you are making your estimates on only the numbers that are being reported, then you are seriously in trouble. That's one. Secondly, they are not among those who are contacts. We can put them into various levels and find how many within contacts are getting positive. The last time I saw the data, they said one person among the contacts was positive. So I started saying, can we check that the efficiency of that test that we are using? Because we have to look at all of that and compare with other tests, because these are new antigens that have been put together to make the test. So that's the issue. So Dr. Norman.
Yeah.
Dr. Norman, please.
I think even the contact tracing is not being done properly. They are using community health specialists to do this.
Yes.
Nurses. When we have disease control officers that are sitting at home, some of them finished university 4 years ago and they have no jobs. Instead of using people who understand disease progression, they are using community health nurses. That is why my initial submission was government is confused about how to handle this whole thing, because it shouldn't be like that. It is about time they recruit the disease control officers to really do the contact tracing, because that is what they were taught at school.
Thank you, Dr. Newman. Let me just say that we advertised that we're going to end at 3 p.m. That has been revised. We're ending at 4 p.m. because of the demand of lots of you out there and the importance of the submissions of my guest and how it's impacting on the conversation that we're having. This is a national concern, and we are at a critical stage. And as a matter of fact, the Minister of Health and the President make the point that the days ahead of us are critical, and that will certainly determine where we're going to go with this particular case. And because this is a virtual town hall conversation we're having, lots of you joining us on our various social media platforms. I have loads, thousands of your messages. I'll try my best to read as many as come in. This one says that, please, if churches and schools in the country are shut down while pubs, beer bars, hotels, beaches, and other social places are not shut down, this virus will continue to spread. So I suggest all pubs and hotels should also be shut down. Thank you. And yes, I agree with Dr. Sewa Ayi, there should be total lockdown in the country, and I think it's one of the best ways to stop the spread. Okay, you didn't add your name, but this one says we must have good education of the citizens because our government is just beating around the bush or about this disease. How are we prepared as a country? Fred Owusu from Kumasi, thank you. Bantuamina, I hope I got it right, from Ampento Bekwai in the Ashanti region, says, I support the lockdown on pilot basis, especially in the cities and the opening of isolated centers across the country. This one says, I totally agree with Professor Benka for a partial lockdown, but a total lockdown, as suggested by Dr. Ayi, will be too expensive for the country. We do not have the requisite resources to implement a total lockdown. I think Ghana has to rely on experts rather than politicians like those you have in your studio. Okay, my name is Sami from Tamale. I think Professor is making some serious suggestions. I have two professors here. Can someone tell where the people who tested positive in Kumasi passed before getting to Kumasi? So we have to lock down and block internal traveling except food stuff. Thank you. This one here says, closing down the schools is even an issue. Just imagine a student in Accra travels to Tamale and has the virus. This one here says the whole country should be shut down because socialization in Ghana is high and people travel a lot. So how will you know that a lot of these people who have been tested positive have already affected others? Please, the whole country should be locked down. As one of the pundits said, my guests. Okay, this one from Tamale, Hadi, says, I think this submission should get to the table of the president. I'm hoping he's watching. Obviously, maybe somebody from the information ministry should be watching, or probably we can serve him with a copy of this whole program afterwards. But you'll say that this is the only way the virus can be contained in Ghana. And this is our own way of also contributing to the discourse. So yes, we're hoping he's watching, but even if not, I know that my colleagues here put some things together to ensure that the president hears some of these things that we're talking about. Now, there's a gentleman who is quarantined now because he arrived in the country 48 hours ago, and as directed, the moment they got to the airport, they were sent to a hotel where a number of them are being quarantined. And he's actually watching us now, and his Twitter handle is, I think, Oswell. So he's just showed us a video of him in his hotel room. We're going to play that video to you right now and what is happening to him. You could just click that for me and let's see what Oswell is doing where he is. And that's what's happening now and where he is. So that's the gentleman. Yes, in his hotel room, watching us now. And it's good to know that, yes, likes of these are following the conversation as we're having. So he earlier tweeted that he had been quarantined in a hotel, and that is what you see. That's there, encouraging. Thank you. Thank you. Lots of your tweets coming through right there. And I still have my guest in studio. I'm going to have to say this, that we have almost 300 of your messages. I'm going to do the best I can to read as many of them as come through, but I still have to get my guest in studio to continue to have this conversation. So quickly, Dr. Bampo, deriving the lessons from how we handled, the Ebola situation, would you say that with the current situation where, for example, this 35-year-old who came into the country from France didn't show any symptoms of the virus, but was tested positive, should the case definition be reviewed? I mean, based on this.
I think the case definition has already been reviewed because initially we were having vertical transmission, people coming from outside. Now we're having horizontal transmission. So there are people who are passing it on to others right here in Ghana. So on that basis, the case definition.
So, I mean, now we were focused on, because the first 10 cases I think were imported. Mm-hmm. This person came in, he actually didn't have contact, from what I understand.
Yes.
But tested positive.
So in that case, for example, there are people who I have read about who didn't show any temperature, and they've still tested positive. So this is a very crafty virus. It can show up in so many different ways. And that's why, using one criterion to try and pin it down would definitely not work. So for example, when I talked about surveillance, I talked about the point of entry and I talked about community surveillance. But most importantly, it's about information so that people, when they feel poorly, can go to hospital and say, I'm not feeling so well, can you test me? But they need to have the info to do that. So it's a multi-pronged way of getting people to have the information, the opportunity to go to where they can get the tests if they want to do. And then the third is the ability to have themselves managed or treated if they have the problem. So you can't base your response on just one thing. Okay. It has to be different because it will come in different ways.
Okay. But Professor Mega, no, sorry. That is if you want to complement the point. If it's a different point, then... Okay, Professor Mega, how about this? I just read that, the loss of smell and taste can actually be a symptom of the coronavirus.
Yeah, so there's so many things about this virus we don't know, and we're going to learn a lot more. But at least let's focus on the major picture. The big picture is that you have a sore throat, you have a cough, and you have a fever, and you can have other things. That should be our entry point. That makes it very easy. Yes, many people will come with a lot of things because it's infecting the whole ear, nose, and throat area. So people can come with different things.
So are you saying that if I have a cough and a cold, sore throat, I should call the hotline?
So first of all, now that we're having horizontal transmission, formerly you had to have a cough, a sore throat, a fever, and a history of having traveled. Now that's no more the case because there's horizontal transmission. The issue is that you have to feel whether this makes you... You see, this is the tricky part. Many people will not have this go to a higher stage, and then it will go away. But they've had an exposure to the virus, and then they will transmit. If we ask everybody who has a cough, a fever, and to go and test, in fact, they will just crash the place because we have only 2 testing places, and they actually are not prepared to take most of this.
But ideally, it should have been the case.
Ideally, since we are here as an epidemiologist, obviously, the test makes a lot of difference what you do to that patient, And thankfully, we have to be up and running. There are tests that are now available. Korea is providing tests that can be done in 10 minutes. And the US FDA has just licensed a new test that is done in 45 minutes.
I think, yeah.
So the issue is that these are the things that we should be getting to deal with our problem. And let me remind you of what Dr. Bampo said, is the end point. We don't want to get many severe cases. If we get to that extreme, we can't manage it. We can't. We are not capable of managing it. So we have to get it at this end of the spectrum. You see, that is why we are talking about this lockdown and everything. If we have 1,000 severe cases, they'll all be actually being sentenced to death. You know what happens? The number of health workers who will contract the disease will go up. Then we have a choice with 150 ventilators. Who will be on the ventilator? Is it the health worker or the patient?
So we get to the point of Italy where we choose who dies and who lives.
Exactly. We will get there so fast. Our system cannot. Can you compare our system with Italy?
No.
Yeah, but if Italy went to that, how do you think it's different from us? So we have to stop this and make sure that the numbers that get ill are manageable, so that those which get to the extreme end, we can humanly do something about it. But if we dither and wait, we will start seeing that is when the public will just come at us, thinking that we don't know what we are about.
And listen, viewers, we're spreading calm, not fear, with facts.
Yeah.
That's extremely important, something that you need to note out there. So the picture we are painting is a reality you need to know based on the facts from the experts to dispel the fear and not managing what you should know. I think it's important, and Professor Dodo made the point that the basic way to deal with panic is by planning and preparation. And I also say the basic way to deal with fear is through facts and figures. Let's just face it as it is. But as we speak, Dr. Newman, let me come to you again. Per the measures, are you confident that we are a step ahead of the containment strategy?
No.
Because of what Professor Benka said, that we should ensure that it doesn't get to...
If you don't test, how do you contain? Because we are operating in darkness because of the lack of testing. There should be massive testing so that we know how many people really have been infected. Without the testing, the containment, the easiest solution is to lock down. We are now waiting. On the 18th of February, in your studios, we were told by Noguchi, Ghana Health Service, that they have the PPEs, they have the testing material. Now we're being told, this is where the confusion of government is coming from. Now we are being told that we are now importing 50,000 of them. Until you really do massive testing, you don't know how many cases you have. And so your containment, the easiest approach is to lock down. Social distancing, as we started by saying, in a big tournament or chamber and hall with 10 people in a room, how are you going to do that?
Professor Dodu,
yes,
you made the point, and I think it's a critical issue that he raises. So, for example, the point about the ordering of these 50,000 kits, there's a global demand for it. You even referred to the fact that if we get to a point that we need ventilators, where are we going to get it from? I think Professor Benka made that point. Do we know, in fact, do you know, as a Standards Authority, where we are getting these kits from?
I don't know, because FDA, the Food and Drugs Authority, will register medical equipment where this will fit under. But I know for a fact that we don't have enough. In fact, we are nowhere near enough. I mean, that is not even in doubt. I don't need to go and check. The reality of Ghana, and we have said it several times, and I like when Dr. Norman said, let's not politicize. So let's bring this to a place where we are looking for solutions. First and foremost, the best way to get solutions is to make sure that officialdom, government, will implement things. And to get government to do that, it's usually not helpful when you say governments have been either incompetent or haven't done things the way they should do or haven't been open. It's about we getting government. So we rather move towards saying that these are the things we want government to do. That's number one. So number two, we need to do a gap analysis of what do we need. And do we have it? We've told you that we don't have ventilators. And I think Professor Benka made a point which is so clear that even, no, it was Dr. Bampo, that even if you have the ventilators, that is not enough. Where are the people? And please note, all the people to operate the ventilators would also need personal protective equipment. So that's point number two. Point number three, we need now to bring the conversation that if we are going to get all these things coming in, what is the way of sharing logistics? In most countries, you may see that the executive may get only X%. Because your focus is on frontline health workers, it's on people who you need to run the country. Can you imagine if enough comes in and the only people who can be supplied will be cabinet ministers or the presidency? So this is where we say that the planning should be open enough and transparent enough that, one, you have to respect the fact that the presidency will get the leadership of the opposition, because they are needed for consensus building. But should that be 5%, 10%? I don't know. I cannot make that decision. From there, the next group of people are going to be journalists and health workers. Why? You are going to drive the country with us, or as fake news will drive the media. That is not acceptable. So you want to be sure that a certain number of your communicators, as in not party communicators, but your main media, then you come to healthcare workers. So this is the logistics side, which obviously time will not let us go through it all. But I think at this moment, we need to ask a honest question. We, all of us, degraded our quality infrastructure as a country. Now we are in a crisis. Pointing fingers is not going to help. We have stated that maybe communication from government has not been transparent enough. I believe that the question we need to move towards is that what is it that we need to expect, and from whom, and how frequently? Because that is helpful. If you leave it that communication is not enough, it's too vague. It's about time now that we are in war. And as both Dr. Norman and Fred have said, fine, we all want to have a lockdown. But we're also saying that there are logistics about lockdown, because if you do not enforce a lockdown, then you might as well not have started a lockdown.
All right.
Professor Benka didn't want to make the point that I will make. I come from Jamestown. I'm an Olympics fan. You look at our social conditions in Jamestown, how we live over there. One virus, and the whole of Choco, Jamestown,
So that's an area we should look at.
I mean, I'm interested because I'm a son of the soil, and they will say, Professor, what that TV, no, wow. So these are issues we have to deal with. You know, so as I come back again, and Doc, once again, I'll thank you. We need to depoliticize this, but we should realize that working in the political environment, if we want our politicians to go along with us, we give direction which doesn't appear to put anyone in a negative light. Other than that, people will sit on their high horses and Ghana loses. But as we move towards that and say, these are the solutions we, the experts, are saying, we are willing to sign up. Indeed, all of us here are being listened to by the country. We are being recorded. Posterity will judge us if we solve this problem or we do not. Okay. And I think all four of us, and apologies once again for leaving you out, all four of us are saying that we know enough. We will fight about the facts because professionals fight. But in the end, if we are being held responsible and we fail, the country will finish us, and the country should finish us because all of us went to school free of charge. So really what we are doing is not doing a favor to Ghana. We are doing what we have been paid to do. But in the time of war, we are the soldiers who should make enough noise that we are at the forefront. Some of us may even be infected, but at the end of the day, we are willing and accepting that we are Ghana's solution.
Well, as of yesterday, some 5,400 thereabout of health workers in Italy had died as a result of the virus. So clearly, I mean, I'm just hoping we don't have this the situation. But Dr. Bampo, you wanted to make a point. I'll come back to you, Professor Dodo, on this issue with sanitizers, because I think the president made the point that actually commended you for speedily certifying
the
FDA, I beg your pardon, I think you work hand in hand with them, certifying these hand sanitizers. You know, there have been concerns that, look, hitherto it took quite a while to have certification. So if you've had to simplify the process because of the decisions of the time, we're just hoping that you're not certifying substandard, you know, sanitizers because you want to meet the demand. I think it's something that we'll have to address. Yes, Dr. Bambo.
I just wanted to share an anecdote to bring up the seriousness we find ourselves in today when you talked about getting PPEs. So I remember in 2014, one of the first tasks that the president at that time gave me was to find 10,000 PPEs.
10,000 PPEs?
Now, remember the Ebola crisis hit 3 countries in West Africa. Less than 30 million in total, maybe far less than 30 million, Sierra Leone, Liberia, and Guinea. And yet PPEs were short globally. Now we have a situation where every single country, let's say 140 out of the 195 countries and territories, looking for PPEs, looking for all the other things, that the test kits and so on. I think it's going to be incredibly difficult for us to source these. And this is where we must put our collective intelligence together. There are lots of Ghanaians around the world who have contacts. And at that time in 2014, even though the WHO said we couldn't find it, we had to go back to Switzerland, get our mission in Switzerland to help us. We went to a little town on the border between Switzerland and Germany to source what they called at that time Tyvek C.
Right.
You know. So the point I'm making is that let us use all our collective intelligence, all our collective strengths as a country. I think we are a bit slow on the uptick, and we are playing catch up. So now we must use all the advantages we have to try and get ahead of the game.
A lot of things we're saying now is something that should have been done prior to this point. Yes,
so I completely support that, and I think this is not something that should be a throwaway. Look, the way to get any of these resources today is by the president himself being on the line.
The president should get on the line.
Yeah. Get on the line to Korea, our partners, South Korea, and say we need the test kits. They've just been licensed, and we need PPEs. He has to talk to the Chinese president. I mean, Trump is talking to Xi to get some of the things, and then you just sit down and wait and order through this. No, you have to go back. Germany can help us. They are doing well. In fact, Germany has the lowest case to death ratio. You can see that the health system is fantastic.
Sure.
So we have to take it to that level, and this is the time for our diplomatic missions to go grab these things and put on the plane and send it here, not wait for some long distance. No, these are practical things. They have to be taxed to deliver test kits, PPEs, and then the masks wherever they can find them, because we are at war.
We are at war.
We are at
Indeed.
war.
President Trump says he considers himself a president at war. And President Benga, you're saying President Kufuor should also consider himself as a president at war?
Yes, because that is what he has sworn to, that he's going to protect us. And I'm saying that Ghanaians haven't seen the people falling. That's why we still are talking. I mean, there'll be a time when you cannot even come here, if the rate at which we are going continues. So let's take this. We are at war. Italy has completely crumbled. The Prime Minister of Italy has given it to God, that they've done everything they can, and he's giving it to God to help them solve them. They are stronger and better prepared than us. They have more infrastructure, they are richer, and look at their neighbors. Talk about here. Where are we going to get help from? Burkina Faso or Togo?
No.
Or Cote d'Ivoire? No. So let's not wait till we get there. Preparation is so important. We've lost time, and this is the time where everybody must be there. Ministry of Foreign Affairs should be the one pushing for the supplies and not procurement, people, blah, blah, blah. There's nothing called like that in the wartime.
It's a wartime.
Yeah, so you have to get these things going. So that's one very important aspect of this. I think you can see that interministerial issue is so important. We've talked about lockdown. It's not for us to tell you the details of a lockdown.
Yeah.
The police, the army, and local government, you can bring them together. They will find better ways of trying to help us to solve. We have to identify the problems, and we have to use the resources that are here. There are many people who can deal with this, and they've dealt with this in other countries where there have been migrations and so on. There are things that people have experienced in. So let's identify the big ticket items, and let's get on the ground and start solving them. And above all, we need to carry the population along by informing them exactly what we are doing.
So, and everybody is actually talking about, most of the messages we're getting, talking about shortage. Will government now be able to meet that demand? Toiletries, good sanitation.
Well,
I mean, we're still battling with open defecation in this country.
Water.
Access to potable water. I mean, these are the realities of the situation. Would we be able to do this?
So this is where we are, and I'm glad that so far we are all coming to some convergence points. Alfred, you made a point about the Food and Drugs Authority agreeing that within 24 hours of a working day, sanitizers which are submitted for approval will be approved. What the Ghana Standards Authority and the Food and Drugs Authority have agreed to do, prior to this, but now we are enforcing, is that duplication, unnecessary duplication, is a thing of the past.
Right.
Now, we've spoken to Ghanaian industry. There are some companies whose raw materials have to be imported. You can mention the edible oils industry, they're out. Sorry. I mean, they can only produce about 30% capacity because they need things which are imported.
True.
When it comes to bottled water, local water, we can do it. And indeed, as we speak, both the FDA and the GSA, we have decided that we are going to support industry to be able to meet the requirements of Ghanaians. So we've stopped, currently all the guns which came, we've been calibrating them. Those which are filled, we said take them out of circulation, get new ones, because we are in war. But now, how do you do this in a way which is, one, coordinated enough that all industry, and I use the word all industry, all Ghanaian producers will know that they can tap onto it? That's one. Number two, how do we achieve enough cross-national consensus across both the political and the social divide in terms of the chiefs and the priests, so that when we begin to push information out, this is what we are saying. Alfred, you asked about case definition. We on this table, all four of us, we will need to look at the case definitions being applied in Geneva and ask whether they apply in Ghana. Because looking at our peculiarities, looking at the fact that we may not be able to test everything, what is going to be the threshold for asking that people should go for tests? 50,000 tests are not enough. You mentioned we have engineers. How many engineers are now beginning to say that, wait a minute, some time ago, Professor Binka here took a net, simple net, and said, let's put chemicals in it. The end result is that the whole world is buying bed nets from us. He's humble enough, he won't say it. But we did those,
wow.
These are things we've done that the whole world is using. And Gates and Co have called us to places, and we've made them, we are still broke though. But I think the key issue is this. Knowing we have engineers, they can come in, then we are going to look at the particle size. We have a textiles lab. So the face mask, what is the size we are looking at? What should be the minimum size for the virus? Is it in microns or nanometers, so that we can determine that, look, Ghanaian engineers, is it 2 or 3 mesh? We can test in real time. So for me, one, we are in war. I believe that the only way you win a war is if there's I don't want to use cross-party, but I'll say if there's a national consensus. How that is done is beyond my pay grade.
But you know that the virus doesn't respect.
Yeah, but you need consensus because in the war, without
I agree
leadership,
perfectly.
We are
with you
not
on
in
that.
war. You know why?
Dr. Newman.
We are in a state of restriction, imposition of restriction. That's very different from state of emergency. So we are not at war.
Should we have a state of emergency?
Yes, we should.
We should have a state of emergency.
We should.
Why?
Because that will, all of these analogies will come into play. And it will trigger certain responsibilities on the part of government. It may be that government is more concerned about money, financing the state of emergency, because the moment you go that route, you have to provide a stimulus package for businesses, for churches, for schools, for TV stations, and so many other businesses. Then at-risk families, people on leave, and very, very poor people who may not be even on leave, students, and so on and so forth. I think even you may have to suspend rent payments, mortgage payments, and so many things. And I think our government doesn't want to go in that direction yet. It may be a bit too late by the time they decide to do that. So we are not at war, so we cannot use that analogy at all, legally.
But we should be considering the situation of a state of emergency.
We are in a state of imposition of restrictions.
But we should be talking about a state of. But I think, Professor Peka, I'll come to you on this one.
Yes.
About the nose masks, because there's been conversation that should we be wearing them around. I mean, considering the fact that now we do know that the virus can stay in the air for 2 to 3 hours. Like 8 hours, I think, and then on surfaces between 2 to 3 hours. And we see in China, people wear it around. But here, we're getting a lot of confusion about the nose mask. So what do we do?
So the truth of the matter is that until recently, when WHO agreed that this thing is airborne, the use of this was only for people who were looking after patients. So the person coughs while you're looking after him and so on. But when this element of airborne came in, that clearly supports what we've seen in Asia. Everybody's wearing a mask, like you said, in China and so on. So if we're in normal times and we are well prepared, masks don't cost too much. So the use of masks, as for me, I agree that people should use masks. Since I started learning about the fact that this can be airborne. In fact, it claims it can be airborne for about 3 hours. Some people are saying 8 hours. 8 hours is too long. How will it sustain that?
Yeah.
So I think masks should be.
So you recommend, from the expert perspective, that we should consider wearing masks around?
Yeah, but the proviso that of what Professor Douglas just said, can we make? There's a lady in Tema or somewhere who is making masks with the local cloth and so on. Can the engineers help her to determine whether it needs 3 layers or whatever layers that will be in it? But I think to wear masks, I recommend that. And without advertising, I have my own mask.
Yes, but I think it's good that you make this recommendation. So now, right after this program, I'm going to grab a mask. Maybe we can be walking around with a mask. Maybe I should have given you a mask since when you came, that we can wear it around. But I think it's a great point that you make. Would you want to align to that same position?
Completely.
Right? We should consider wearing masks around, and this is coming from the experts, so you keep that in mind if you're watching. And then comes to the issue of demand. So then if the demand for masks begin to increase based on this recommendation that you have made from the expert perspective, then can we be able to meet that demand? That's just another critical question that we should be asking.
I think that is an issue. Indeed, if you go to the World Health Organization website, as of this afternoon, the proviso against people not going for masks has more to do with the fact that they are in short supply and they are needed by frontline health workers. So the worry is that if everybody uses it, so it's not like it's bad to use, as my 2 colleagues have said, but basically, do we have enough to go around? And how do you cure that issue about we not having enough? So I believe that it's not just with masks. I believe at this stage we need an inventory of how many ventilators we have and where they are. Probinga said it, we have 16 regions. If we have less than 150, that means that one region will not have some. I mean, even if it's 10 per region. And as you and I know, probably 85% of them are in Accra and Kumasi. I mean, Greater Accra and Ashanti region. So now, this is a time where in the crisis, you begin to discuss how your logistics will be positioned. So basically, you look at OT region down by how many do you need there? You look at upper east, upper west, I mean the various regions. Then secondly, you need to say that, okay, what is going to be the holding point that in case there is a need to move from one place to the other, you can recirculate. So Dr. Norman, I agree that legally we cannot use the word we are at war because there's no state of emergency. But I believe that we should be planning as if we are in a war.
Okay.
In that case, logistics become key. Vehicles, fuel, payment, money, because we are asking healthcare workers, come out in your retirement to help us. How are we going to manage it? And the biggest worry in the crisis is if the tools you give are defective tools. Indeed, when you ask a question about the sanitizers, my biggest worry is that if they have not been approved and they are containing less than 40% alcohol, when they should be containing 70%, then you're actually giving people false confidence and they will go and use a product for protection which doesn't protect. That is one side of the divide. The other side is that you need personal protection equipment. You need to train and indeed motivate nurses. Men and women are going to leave their houses for 2 months. If they leave some 2,000 cedis at home, they can go and come, knowing that the home front is peaceful. So we should move this from big English. For me, the practicalities are that you need to have your healthcare workers ready. You need the country to be in a state of readiness for war. You need to get your politicians and your leadership aligned that you are going to take instruction from one general. He is a field marshal. He should have enough trusted people who sign up that if our advice fails, we failed. And I believe that Ghana has all, so that from case definition to this, we cannot rely on other people's case definition forever.
No.
We work with the global community. Fortunately, all of us have worked with too many countries. But we also know that every country is thinking of itself. And as Professor Binka said, indeed, respectfully, we're asking our president that you have contact, please, on the phone. That is, if he hasn't done that already. If he has, we want to know. Because at the end of the day, we want to know where things are, so that we will not make calls. We don't want to duplicate the efforts. Once we know all that, and once we are telling the country that these are the masks we have, these are the tanks, I mean, this is everything we have, I think it gives people confidence. If we leave it and people feel like we are going to use it for different purposes, then they have a right to complain.
Dr. Bampo and Dr. Nima, I know you have a response to this, but as I said, because this is a virtual town hall that we're having, lots of the messages are coming through, and I really would want to give due reference to the messages. So this one here says, good afternoon, thanks for your education from your panel. I hope the government and his ministers should put away politics and tell us where the funds for this deadly disease are coming from. You see, can they borrow the money from the new biometric rate? Okay, so yes, thank you. This one here says that I agree with Professor Benka, no training, PPEs, and even isolation areas for some earmarked facilities in the Upper West region. To the panel, why is there no Ministry of Public Health in Ghana? Probably want to answer that. Joseph, thank you. I don't know which one of the panel would answer, but yes, Professor Benka says he would answer that. Good afternoon to you and your panel. I enjoyed your program. I think it's about time we push politics aside and deal with this disease. If big countries like Italy lock down, why can't we do the same when we are even lesser than them, you say? Thank you. Hi, this is Kweku. Why did the leaders wait for the people to bring the disease before shutting down the borders? Do we have the equipment that could detect the disease in our regional hospitals? Thank you for that. This one here says the country should involve the various tertiary institutions, especially with support. We have students in the final year who have gone to a lot of clinical practice and are well prepared to do everything. Call on the universities, the various College of Health and students. Let them volunteer. Let us all put our quota into helping. Thank you. I think the president made reference to that. Some volunteers and retired health workers who are actually coming in as well to help in this time. This one here says that we citizens lack adequate information, which is a threat on its own. I think government should allow us have reliable information. Even the borders should have been locked a long time ago. Right now, we agree that this is what should have been done. I think the most important thing is what should be done right now and the days and months ahead of us. Thank you so much. This one here says, good afternoon. Please let's employ the right persons for the virus. Please let's test, do more on our people. If not, we will be like Italy. Hopefully not. Adam from Prestia says the lockdown of the country should have been done a long time ago, but the government waited till the virus. I think the lockdown should be in the regions which has recorded cases, that's Kumasi and Accra, to avoid the spread. This one here from Nungwa, you didn't add your name. We should be encouraged to get tested. Where can I get tested, please? Professor Dodu, I think we'll have some information based on that. Or, Professor Mika, we'll give some updates where you can get tested. This one here says that I stay in Tema and a lot of us cannot simply practice social distancing. We need the lockdown. I passed through Medina Market and Tema Market this Saturday. Look, I was there myself. I had to just return because the crowd I saw, oh my goodness. If the virus was anywhere near that place, I don't think we will be talking 24 now. But Albert from Kaswa says, is the government prepared to help the average Ghanaian when the country is on a lockdown? I think that question was asked. Yes. Abdul from Tamale says, it's been a nice conversation, the current pandemic we face, about the current pandemic we face. If Ghana couldn't prevent the virus from coming in, we should be able and work tirelessly to stop its spread. I wish the frontline persons in this fight could adhere to Prof. Benke's thoughts. This one from Amasaman. Hello, my name is Kweku Ando, enjoying your program, but in one way or the other, we the people of the deaf and dumb feel neglected in this pandemic. Wow. My advice to the government to have more infrastructure to be built to combat this pandemic than you say the National Cathedral. I think the point you make, even beyond this whole reference you make to the National Cathedral, it's about the deaf and dumb, or persons living with one form of disability or the other. Interesting point there, and I'll have my guest respond to that. Everest Newton in Akim Achiase, please, I agree that the whole nation must be on a lockdown to save our lives. The government must declare total shutdown before it's too late. Che Emmanuel and Everest Newton, thank you. In consideration of the expert advice worldwide, we must stay at home. Government must implement partial lockdown in our cities now. Williston in Accra. Thank you. Grace Otu in 2nd. I am grateful for this wonderful discussion with these wonderful men. In fact, I am learning. In fact, there was a woman who joined us as well. So, yeah, I'm learning a lot from your topic. But please, can you talk to our MPs, ministers, and our chiefs to help the president by giving him some money from their own coffers to get the nation the equipment needed to fight this? Well, it's a proposal that can be looked at. Yeah. Maybe they can forgo this month's salary. Yeah. Something like that. I mean, it's possible. Yeah, yes. Isn't it?
It is.
It is, Prof.
Yeah, yes, it is.
Okay, so good afternoon to you all. I think this country is not handling this COVID-19 issue well. I'm a health worker at one of the Ghana border towns. People do come through unapproved routes to our town and facility for health care, yet we are not trained to handle this case. In particular, no PPEs, and I pity us. A very insightful discussion indeed, thanks to TV3 and your panelists. Can your panelists paint a vivid picture as in details of changes in activities in all essential sectors during a lockdown in this country, including responsibilities of government towards buffering the impact of a lockdown? Francis Adeji Bato, thank you. I really can't take any more of the messages, but I'll try before we go on off air, try and squeeze in as many as possible. But before I get the responses from my guests, the number of you who asked questions, I'm going to go for this quick break, acknowledge our sponsors for this conversation we're having. This is an expert panel here on TV3 on Ghana's assessment report on the fight against the coronavirus, where we are and what should be done in the coming days to ensure that we don't have a serious situation at hand which we cannot handle. This is TV3. We'll be back shortly. Stay with us. Welcome back, and this is the expert panel that we're having. It's a conversation on the COVID-19 Ghana status report, where we were, where we are, and where we're going, and what measures we put in place to ensure that we don't get to the stage where we cannot handle the situation. We've done an assessment of the measures that have been put in place so far and those that have been announced by the president over the weekend, and how effective it would be. Proposals have been made, over the last 120 minutes and over that we've been having this conversation with my guest in studio about what should be done to ensure that we don't get to where we don't want to get to. And it's all about spreading calm, not fear, through facts and planning and preparing to prevent panic. This is what we're doing right here, and joining lots of you with the comments that you've been churning out on our social media platforms. Thank you so much for the commendation, and indeed goes to our guests and then also the production team here putting it together here at TV3. We're live on DSTV channel 279, TV3 Ghana on Facebook, also on 3FM 92.7, Onia 95.1, Connect FM in Takoradi 97.1, and Akoma as well in Kumasi and beyond, and on 3news.com, TV3 Ghana on Facebook as well. Dr. Ishmael Norman is with us in studio. He is the president of the Institute for Security, Disaster and Emergency Studies, and Dr. Victor Bampo is a former Deputy Minister of Health and a coordinator of global financing and technical support on UN AIDS, and actually one of the focal persons during the Ebola outbreak, and he's been sharing a lot of experiences with us, and he makes the point that post-coronavirus knowledge and experience will drive the world. I think that is good that all my guests have been making references to what has happened in the past, what is happening now, and what we have to do to ensure that in the next outbreak, which cannot be prevented, we will be better prepared to handle it. Also having Professor Alex Dodo with us in studio. Beyond the fact that you don't know as the Director General of the Ghana Science Authority, much more importantly, he's a clinical pharmacologist and the director of the WHO Collaborating Center for Advocacy and Training at the University of Ghana. And also Professor Fred Newton-Binka, who's a professor of epidemiology, who's been sharing lots of knowledge with us on what to look out for at the School of Public Health, University of Health and Allied Sciences as well in Hope. Gentlemen, before we went for the break, I read through some of the messages. I'd like us to respond to some of the messages that came through, and then what indeed you think that the country should be doing, because there was also the mention of, for example, if we have to get a lockdown, what are some of the things that should be in place, because those suggestions have come from some of you. Dr. Newman, please.
Norman. Yeah.
Yes.
On the 20th of February, at your station here, I passed a list of things that people should get to prepare in case we go into a lockdown, because I've been thinking ahead of this situation. I think if TV3 will be kind enough to post that list again, it will help a lot of people.
As a matter of fact, we've been playing it prior to today.
Oh,
just to make the point that you said something. Should have been.
Thank you. So that list people should really, in order so that we don't do a rush on the markets, we should start buying a piece a little bit at a time. I think companies can advance monies to their employees so that they can start stocking up on things that they need. I think government should begin to assess how much food they have in a buffer stock. I know that NADMO keeps a certain amount of supplies at the headquarters. They should start to begin to package some of these food items in case we do. The reason why I'm saying all this is that the prisoners have to be taken care of. Somebody has to feed them. People, handicapped, people with disabilities, and there's one of the posts that came through this morning, afternoon, people, deaf and dumb people, physically challenged people, they all have to be catered for. Single mothers that are basically, they don't have jobs, teenage mothers. We have to really do a very systematic review of what the needs assessment should be, and that we haven't done as a country yet. And so we should do all of these things so that in a lockdown, people will not starve to death. Because if we don't do it well, people will starve to death in their homes. People will go thirsty and become dehydrated, and we know the consequences of that. So there's a lot that needs to be done, and the reason why I appear to be sometimes taunting the government is because I think there's a lot that the government is not doing that the government could do. And because I have faith in the ability of government to make us feel better, and it's not doing, that's why sometimes I'm a little bit aggressive in the way I present things to the government.
Well, but I think that it comes across well because you're very clear on exactly what you want to be done. And to be honest, no apologies to that.
Thank you.
Okay, is it on what we should do?
Yes. No, not on what we should do. I think that was on some of the text messages that came through.
Yeah, most of the messages which came through clearly, like we stated on this panel, we need to plan, we need to prepare, we need to avoid panic. But how do we do it? And I'm going to follow on from where Dr. Norman left off. He said a few things. There are a few things that Ghanaians need if we have to move forward and avoid any hunger. Food, we have enough food in the country, but it's got to be distributed. And if there's a lockdown, how does food move from one place to the other? Fortunately, we have all the fish we need in Ghana. Usually, we don't eat too much fish and then the poultry. But I think I'm going to take it to one level higher. In this period, for you to get your water, you might need your electricity. So you need your utilities to work non-stop. If water, electricity, or even data should go bang, there's going to be a problem. And there's a time to begin to have the conversation whether the data companies, the companies,
the telcos,
couldn't be supplying some, I don't know what you call it, whether some free data to support people in their communication. So as far as we need food, we need this, but we need the utilities to work. We need, at the highest level, to know what information the citizens need and which source to get it. And I'm saying that because the president has come out 3 times. But on a daily basis, the country needs updates from one single authoritative source. Why am I saying so? In our eagerness to help, too many people are giving information. Sometimes even the same state agencies are all issuing information, but are they consistent and coherent? And when people hear too much and there are small nuances, they tend to stop listening because they are just tired of listening. So we are begging, we need one single clear authoritative source giving us information at predetermined times that everyone knows that we are being brought along so that we follow from there. Then others can take that information and spread it around. We need our food, we need our water, we need our utilities. I think beyond that, what I call the quality infrastructure, Food and Drugs Authority, Standards Authority has to do, and we are doing, but we are announcing this publicly to industry, is that wherever our services are needed, we have offered to offer them immediately. I mean, there is nothing like a delay. Right. Where a few labs can be kept 24/7, we will do that. Because this is no time to be saying, go, come, fill a form. No, there's no time for that. Last but not the least, it's about time, as Prof. Binka said, to begin to think of how do we repurpose some of the laboratories we have in the country to serve the needs of corona. Please, 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 people are calling for test kits. Everybody wants to be tested. I beg you, I beg Ghanaians. We must only go to accredited places for testing.
Where are these accredited places? Because that was one of the questions that was asked.
I am only going to mention the 2 that we know, Noguchi and KCCR. Why am I saying so? There are about 2 or 3 private facilities whose owners have called me that their names, they are offering testing, but their numbers were sent out and they haven't prepared to receive the people. So now they are having, quote unquote, a lockdown. So even the information we give out, yes, I can't mention their names because they are warned against it. So mentioning it here to kill me. But one of them called me and said, like, so this is what's happened. We don't know who sent our names around. And as people come in, now our routine care is affected. These are people who suspect they may have the case. So we are being deluged with potentially dangerous people and we have a problem. So government, as I'm part of government, so we would have to come up immediately with where the testing centers are and what the tests are. And we beg people, I'm begging the population, don't just go to round the corner, be some lab, because there is a potential for people to profiteer illegally out of people's misfortune. I mean, it is not inconceivable to expect people in far-flung places offering corona tests when all they are doing is just nothing. So, and this is where, once again, I would agree that government needs to say, these are the test places. that you can go for an accredited test.
Maybe I think that the point about stay at home and call these helplines is something that we could reiterate as well, because for now the communication is that if you feel like you have the symptoms, call the helplines. Stay at home, call the help. They will come to you, take your samples, and then
it's good, but I think we can do a bit more. You know, Alfred, in a liberal democracy, even in war, people have some liberties that cannot be taken from them. So not everybody who is calling is ill. They might be the worried well. Where do they get information on what to do? For instance, you may want to know, where do I get testing? Yeah. It may be frivolous, but it's your right. So I think in addition to the hotline, all of us need to identify how to give credible information to the populace. True. Because it's their right. They pay their taxes. So that in times like this, we protect them.
Professor,
yeah, okay, so let me just follow up on that, and then I'll answer one of the questions. So the problem is that we're getting into the local transmission. I'm suggesting that we should separate these areas so that the sick people who are in our health facilities don't get into trouble. Most of them are immunocompromised with their illnesses. So I would prefer, as I continue to say, move the thing away from Kolebu, move it away from Konfanochi Ridge. Let's take it to University of Ghana. The medical center is quite well done. And I'm still reminding you that in the early phases of the disease, when people test positive and not so sick, those dormitories there can take care of people if nurses are there to look after them. Most of the treatment we have today is supportive treatment. We are not having drugs to kill the virus yet. I'm sure we'll get something going on that line. But it's supportive treatment, and those facilities there are good enough. They are next to the
University of Ghana?
At the University of Ghana.
Okay.
Because they can have one cubicle each, as you have around, and there are thousands of those cubicles there.
Yeah.
It's the same at KNUST and the hospital. So that will move this calling. In fact, I've asked my students to call those helplines. Disaster.
What happens?
You try and call them.
No, what did they experience?
So what they experienced was that everything they were asked to wait. They will find a telephone number to direct them to. So they are not answering questions. They are listening to your questions and trying to see, is it a lab information you are looking for? Then they will come back to you later on and tell you, call this number.
Wow.
So you just try it. I mean, I might be wrong, but that's what my students put together, that these call centers actually were not so good enough.
I see.
The other thing related to, one of your callers was talking about the Ministry of Public Health. Ministry of Public Health, is that?
Yes, it's the one who has the Ministry of Public Health.
Yeah. So, I mean, that's my pet's area. So, I thank you very much for raising that. I think that we have reached a stage where something has to be done. There's a proviso. Public health will always be paid by government. Always. You can't run away from it. If you don't pay, your population will pay with their lives. That's public health. Clinical health is different, and I think seriously there should be a consideration that all these capacities we are developing should go to build the Ministry of Public Health with an infectious disease hospital and infectious disease hospitals in the various areas and the regions, and then life will be easy. The knowledge we acquired from Ebola will have been followed up because some people will have made it their duty to make sure that those things are preserved, and we use it to fight the next epidemic when it comes.
I think Dr. Bampo will be very available if the government calls on you, right? Yeah.
Yes.
For any form of assistance. Thank you. I think in 30 seconds, I want to answer two, and then we'll go on to the conclusion. There's a question about azithromycin and chloroquine.
Okay, yeah.
Please.
So azithromycin, chloroquine, it's been shown in a couple of studies that they can protect. In fact, it started with chloroquine, and other groups added azithromycin. Azithromycin is also a wonder drug now. We tend to add it to almost everything. So they found that, in fact, the report from France said they had 100% cure. But you see, all these things this is repurposing a already registered drug. That's the easy part of it.
Right.
Because safety data is available and you are doing the repurposing. What would have been nice was for us to do something very quickly here and see how this thing works. In fact, after we said this on television, I went to try and get some hydrochloroquine, and people have bought all in town.
There's none.
There's none.
There's chloroquine shortage.
I called Professor Dudu to try and get me some chloroquine, and the idea was to try and look at whether there was a preventive aspect. By finding, when we find the cases, we could throw a ring around and treat those people and see whether the conversion to positivity will be. And that's a straightforward, simple thing that we could do to help.
Professor Norman, the trotro situation.
Dr.
Do we now engage? I mean, GPRT is saying that, look, if we are reducing the number of people in there, then we should have some subsidy from government of a sort. Maybe in 30 seconds on this one, then we'll conclude.
I believe that should happen, because once you shut down a business, you have to, it's no fault of theirs that the business is shut. This is why maybe government doesn't want to go into a state of emergency, because these companies, these businesses will have to be compensated. And so that's where we are. But it would be good if government would take a bold measure and shut them down.
That's the way you want us to go?
That's the way I want.
For example, with these trotros, so instead of having 23 passengers in one trotro, you would recommend, say, like what? How many?
In one trotro, it's not profitable for them to operate. That's the optimal level that they have to operate. So if you reduce the number of people, they won't even follow the regulation. And the best way is to actually reduce, because people sit too close in a trotro, and there's a lot going on in a trotro. So for me, I think government has to really plan well.
Right. In a minute, let's give, where do we go from here? Recommendations, please.
To government,
yes.
Government should really come up with a lockdown, the Accra, Kumasi, Tema, as has been suggested on this platform. To business community, they should provide loans to their advances to their workers so that they can start to buy food, medicine, and water and prepare for a lockdown. To the banks, I believe that government, central bank, should start putting a program together to a stimulus package, because this economy is going to tank no matter what we do.
Thank you so much. Dr. Bampo.
I'll look at it in two aspects. In terms of how the supply side, I think we should look at short, medium, and long term. Short term, I think we should look at public education. We should look at how we give communities the power to do surveillance to make sure that they pick up cases. Thirdly, I think that we should prepare our health facilities and our health workers to be able to deal with the epidemic by providing them with the PPEs, providing them with the training. So I think we should get ready in those three areas. In terms of the medium term, we have health facilities that are yet to be finished. We should look at how we would complete those to increase the number of health facilities we have. Long term, I think we should look at how we can avoid these challenges in the past, so that in the future, so that when we have some of these challenges, we learn from the past to guide the future. So, and then we talked about the major master plan that we should do with all these elements that we've talked about. So that's on the supply side. But I think one of the things that we should remember is the responsibility of the individual. Let us not forget the things that we started talking about in the beginning. The fact that you need to wash your hands, the fact that you need to keep a safe distance, social distancing, do the things that you do to keep yourself safe. The final thing I want to say is that we know that this disease is not kind to the elderly. For now, let's stay away from our mothers, our grandmothers, and so on, so that we don't put them in danger.
Thank you so much.
So what I will say, what I've said from the beginning is that we need to plan, we need to prepare, and we need not panic. And on this panel, we've all had very useful inputs. The only thing I'm going to add to it is that all state actors, and I mean anybody who works for government, our focus in this time of extreme national difficulty should be to serve the population, to ensure that when people need our services, book long and red tapeism and trying to carry yourself beyond your weight doesn't come in. I think this is a time when the only way the country is going to listen to us is the attitude we give towards the country. And it's critical that we are seen as helpers, facilitators, to move this country to a successful outcome. And last but not the least, I believe that we must start our scenario planning today. Scenario planning, what is the worst case scenario and what happens, so that we do some drills on a weekly basis to ensure that Ghana is prepared for the worst.
Thank you so much. Dr. Benka.
Yeah, so I just want to endorse what my colleagues have said. Let me re-emphasize that I think the clinical treatment aspect should be localized. It cannot be for everybody. If we localize it and we plan it well, our success rate will be better and we will protect the health workers. Please, if the health workers start getting the disease, we are doomed. There will be big trouble. So we need to protect the health workers. Secondly, as has been rightly pointed out, we have trained people, students and so on. Even some of your commentators said that can help in case finding, and they must be brought together to try and help as we go forward. Finally, please, let's provide the resources. Resources so that people can get to work. And I will really want to see, going forward from here, that when we are making reports, we are told reports of what happens in every region. There are 16 regions now. Let's see what you are doing. From all you are hearing, we become Accra and Kumasi. No, Ghana is bigger than that. Sure. Can we make sure that we get to know what is happening and how they are being supported to deal with this problem?
Thank you so much, gentlemen. And your self-discipline will save our lives, all of us. And then also want to thank Dr. Ayi for joining us via Skype from Iowa. Thank you so much. Thank you to Dr. Ishmael Norman, who is the president for the Institute for Security, Disaster and Emergency Studies. Also, Dr. Victor Bampo, former Deputy Minister of Health and Coordinator of Global Financing and Technical Support, UNAIDS, also one of the focal persons during the Ebola outbreak, and he's been sharing experiences with us as well. Thank you also to Professor Alex Dodo, who is a clinical pharmacologist and the director of the WHO Collaborating Center for Advocacy and Training at the University of Ghana, and the Director General of the Ghana Standards Authority, and also Professor Fred Newton Benka, Professor of Epidemiology at the School of Public Health, University of Health and Allied Sciences. So, gentlemen, we can't thank you enough. But one thing that excites me is that they say that the expertise is very much available and ready for the president, government to tap into to save the situation as we have it. And I want to say thank you to our supporters, Carex, for providing us with the hand sanitizers and all the support as well to make sure that we stay safe. Ladies and gentlemen, these are not normal times. But in the midst of it all, one thing we do know for sure is as we do the right things, put the right measures and mechanisms in place, the best answer to panic is preparation and planning on your part as an individual and then on the part of the nation. We can leave you with this, that self-consciousness is key. But on behalf of the team here, our Media General, production team, management and staff, frontline staff here, want to leave you with a note of hope that fear will be addressed through facts and figures. I am Alfred Okanse. Spread calm, not fear. Thank you.